Good morning. My name is James Valentine, and welcome to the externally led, patient-focused drug development meeting on Fabry disease. I'm here with my co-host David Feldman from the National Kidney Foundation, and we are coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the U.S. Food and Drug Administration's headquarters are located. It's my pleasure to introduce David, who's a Senior Medical Project Director at NKF, to provide some welcoming remarks. David?
Thank you, James. Hello, everyone, and welcome to this ELP-FTD meeting on Fabry disease. The National Kidney Foundation is proud to partner with Jack Johnson and the Fabry Support and Information Group to host this meeting. And I thank Jack for his strong collaboration during the past year of preparation. As of this morning, over 90 people registered for this meeting, including patients and care partners, FDA staff, representatives from pharma companies, nephrologists, researchers, and other interested groups from 32 states, and one person from Turkey. Of course, we would have preferred to meet in person, but to protect the health of everyone involved, we are meeting virtually. So why are we having today's meeting? Well, when the FDA decides on whether to approve a new drug for a disease like Fabry disease, they review all the scientific, medical, and other information that the sponsor company submits. But the FDA also wants to have patient input on such topics as what symptoms are important to patients, in what type of clinical trials are patients likely to enroll, what do patients need from new medicines for their disease, and what trade-offs are patients willing to accept in a new treatment. Besides the FDA, another group that needs this type of information is the pharma researchers who are making and developing new drugs. Because if they don't know what's important to patients, they can't make drugs or design clinical trials that will matter to patients. So during today's meeting, we will discuss these topics, and you can tell the FDA and researchers what is important to you. These are the two most important groups that will determine what treatments become available to you. And they want to hear your input because they know that you are the experts in living with Fabry disease. The National Kidney Foundation wanted to have today's meeting because kidney disease is very common in patients living with Fabry disease. However, Fabry disease is a multi-organ disease, so we want to hear from you whether or not you have kidney involvement, regardless of your age, or how severe your symptoms are, or what stage your disease is in. Your feedback today can actually help influence drug development for this disease. So please, don't be shy. Make your voice heard. Call or write in with your experiences and perspectives during the discussions today. And now I want to thank several groups of people. First, to the patients who will deliver testimonies today. Thank you for your dedication and hard work to develop your talks. It's been an honor to work with you. You have taught us an enormous amount about this disease. Thank you also to our discussion panelists for the important insights I know you will contribute to today's discussions. And thank you to our expert presenters, Dr. Andrzej Rastogi and Dr. Eric Wallace, who will set the stage for our discussions today. And of course, a warm thank you to the FDA for agreeing to participate in today's meeting. And at the FDA, I want to thank Shannon Sparklin and Karen Jackler for their support during the planning of this meeting, and Dr. Petrula Saboku for the presentation she will deliver today. And of course, I want to thank our sponsors for supporting this meeting, Chiesi Pharmaceuticals and Sangamo Therapeutics. If you want to see the agenda for the meeting, just scroll down to Meeting Resources on this live page. And just one last word. In each of the National Kidney Foundation's 5 previous ELP-FTD meetings, there is one point that has consistently stood out. Patients, care partners, and families are looking for hope. Hope for better lives and better treatments that will relieve the tremendous burdens they face from their diseases. So we hope that today's meeting will give you a sense of hope that the groups who are responsible for developing and evaluating new drugs for this disease are listening and working toward making and approving new treatments that will be meaningful to you. So let's get started. I'm happy to introduce our first speaker, Dr. Petroulis Boku, who is the Deputy Director in the Division of Rare Diseases and Medical Genetics in FDA's Center for Drug Evaluation and Research, where she is involved in scientific review and regulation of products intended for rare genetic diseases. Dr. Spoku will now speak about why today's ELP-FDD meeting is important to the FDA. Dr. Spoku, thank you for joining us today.
Thank you, David. Just want to check first, you can hear me and see me okay?
We can, yes.
Great, thank you very much. So thank you for the introduction. Thank you for inviting me to speak today at this very important PFDD meeting on Fabry disease. By way of introduction and as a background, I'm a physician specializing in genetic diseases, and I am part of the team of scientists at FDA within the Office of New Drugs who are involved in regulation of medical products for Fabry disease and other rare genetic diseases. And that includes providing scientific advice to drug developers and also conducting regulatory reviews of investigational new drug applications and marketing applications for new drugs. So we are all gathered today to listen to patients and their families, provide a firsthand account of what it is to live with Fabry disease. As we all know, Fabry disease is a rare disease. It is multisystemic and it is complex. We know a little bit about it. There's a lot we don't know about it, and we're all very eager to learn. And the first area that we want to focus on and learn is from the patients who actually live with it on a day-to-day basis. So patient-focused drug development meetings like today's meeting on Fabry disease are very critical because they provide an inside look at the experiences, the impacts, the perspectives, and also the needs of those living with the disease on a daily basis. The patient perspective and the patient experience both play a critical role in the development of new drugs and in the assessment by FDA of new drugs for the disease. And as David mentioned, we all recognize that patients are really the experts in their disease, and only they know firsthand the impact that it has on them and their families. So today we will hear what symptoms and burdens matter most to patients, what their needs are for new therapies, what available therapies address and what they do not address, also what risks patients may be willing to accept for a certain benefit from a new drug. The ultimate goal of these PFDD meetings is really to ensure that patients' experiences, perspectives, needs, and priorities are heard, and that they are considered and incorporated into drug development and evaluation. Specifically, the hope is that drug developers will understand the needs and views of the patients, use those to guide how they design trials. In the same way, we at FDA use the patient's experience, needs, and perspectives to inform the advice that we provide to drug developers on how to develop their programs and their clinical trials to make sure that they are successful, but also that they actually serve the patient's needs. Importantly, an essential part of our regulatory review of marketing applications for new medical products involves assessing the observed benefits of the drug shown in clinical trials and weighing those against the observed safety risks also shown in clinical trials. And also consider the remaining uncertainties for both the benefit and the risks. And central to this determination of benefit versus risk is really the patient's perspectives, their preferences, the views, and their needs, and specifically their unmet needs. So the information that we obtain at today's meeting will really strengthen our understanding of how Fabry disease impacts patients and also their families, and also be able to hear what their needs are for new therapies. The information that you provide today will not only help those of us who are present at today's meeting, but since it will also be compiled into a report, it can inform all stakeholders well into the future. I want to say thank you to all the patients and the families for openly discussing your experiences with Fabry disease. These are very sensitive matters and very private, and we all appreciate you being willing to openly share that with us. So we are all here today to listen and to learn from you. Thank you, and back to you, David.
Thank you, Dr. Spoku, for that excellent overview. And now it's my pleasure to introduce our next speaker, Dr. Andrzej Rastogi. Dr. Rastogi is Professor and Clinical Chief of Nephrology at the David Geffen School of Medicine at UCLA. And among his other activities, he directs the UCLA Fabry program. Dr. Rastogi is an expert in Fabry disease, and he will speak on the natural history and treatment of Fabry disease. Dr. Rastogi?
Thank you so much for the warm introduction. My name is Andrzej Rastogi, and I want to thank Dr. David Feldman from National Kidney Foundation and also Mr. Jack Johnson from FSIG for having me over here and speak today about Fabry disease, the natural history of disease and treatment. This is a slide showing my disclosures. They're listed on the slide. Now, let's talk about Fabry disease. It's an X-linked disorder. It's a genetic disorder, and it falls under lipid storage disorders. And in a broader group, it falls under lysosomal storage disorders. And we'll be going over this in a bit more detail, the LSDs. The enzyme that's deficient in Fabry disease is called alpha-Gal A, alpha-galactosidase A, and it is a lysosomal enzyme. And its deficiency leads to accumulation of what we call GB3s or GL3s, global triacylceramide. And this accumulation leads to deleterious effects on the tissue and the body. Fabry disease is a multi-system progressive disease. It affects almost every single organ in your body, but more importantly, the cardiovascular system, the kidneys, and the neurological system. And this leads to increased morbidity and mortality that we see in this patient group. And as mentioned, this is a genetic risk factor for kidney disease, cardiovascular disease, and stroke. The disease is pan-ethnic, so there's not any specific race or ethnicity as far as we know that is predisposed to this. The reported incidence is listed over here, but the actual prevalence and incidence might be much higher, as we are seeing from the newborn screening also listed on this slide. So inheritance, it's an X-linked disorder, and classically we have been taught that X-linked disorders don't affect females, but that is actually not true anymore. X-linked disorders can affect females. It could be the entire spectrum, from very minimal, if any, manifestations to the entire spectrum. So now we call females with these X-linked disorders as heterozygotes and not carriers. And I think that is really important point to keep in mind. And this is the gene, the alpha-Gal A gene on X chromosome. This is the enzyme, and this enzyme breaks down GB3. And when the enzyme is deficient, there's accumulation of GB3 in the lysosomes, leading to abnormalities, the cellular, tissue, and organ dysfunction. Important thing to keep in mind is the accumulation of GL3 starts in utero, even though the manifestations happen much later. And the presentation of Fabry disease is divided into two broad groups with overlap, the classical versus the non-classical or atypical phenotypes. The classicals have less than 1% of the normal enzyme activity and tend to manifest more severe disease and earlier in age group. Non-classical, on the other hand, have some residual alpha-Gal A activity. They present a bit later in the age group and have a variable disease course and tend to be milder than the classical variants. But once again, there is variability in that as well. Now, the it's a multi-system disease, and like I said, it affects almost every single organ in your body. But important things to keep in mind is that there's a difference in what age they manifest. In childhood, there will be numbness and tingling in your hands and feet. There might be these skin manifestations called angiokeratomas. There might be eye findings called corneal verticillatas that are seen only on slit lamp examination. They might come with lack of sweating, manifesting as heat intolerance, or significant GI symptoms, pain, diarrhea, nausea, vomiting. And as they progress to adulthood, more serious manifestations, including kidney failure, the cardiovascular disease, and cerebrovascular disease start manifesting. And this is what leads to really increased morbidity and mortality in these patients. Early diagnosis and treatment is critical. And this is the burden of disease. Like I said, when on the y-axis, and this is the time and age, and the manifestations start in utero. But over time, if there is no intervention, which will depend upon the proper and early diagnosis, there is progressive loss of function, eventually leading to organ failure. And key, once again, is early diagnosis and treatment. The disease is as it has myriad manifestations. There's a lot of misdiagnosis. They're listed over here. And this misdiagnosis leads to two things. Number one, it delays the right diagnosis and intervention. But also, if there's a misdiagnosis and you treat that misdiagnosis, that by itself can have its own adverse event. So it's very important that we do get the right diagnosis early and intervene with the right treatment. The diagnosis itself is pretty straightforward. In majority of cases, a simple enzyme activity testing and the gene testing should cleanse the diagnosis. So once you've identified a patient, the testing portion is not that difficult. In male patients, classical males especially, the less than 1% enzyme activity should cleanse the diagnosis. In females, you normally will have to do the genetic testing as well. And once you have identified the patient, once you have tested them, how do we manage? And the key thing is, this is a multidisciplinary approach. And multidisciplinary meaning that multiple specialists work together. Now, the goal is early diagnosis and treatment and prevention of further progression of the disease. The multidisciplinary team involves multiple people: the geneticist, the counselor, the nephrologist, which is a kidney specialist, the neurologist, the heart specialist, pain counselor, psychologist, specialist nurse, and a lot more, and more importantly, a coordinator. So I think those are key team members that are part in providing the care to a patient. And also keep in mind, for every Fabry patient that's identified, there are 5 family members who have Fabry disease. So testing of at-risk family members is quite critical and something that should not be forgotten. So, and when the patient is initially diagnosed, there's an initial assessment of each organ system, timely treatment, and also schedule of assessment. So once we do baseline testing, then we do schedule assessments on 6 months, 1 month, 6 months, 1 year, 2 years, so on and so forth. And this is important to look at the progression, but also if you have any intervention, if that is working in your patients. And what do we have in current management? Enzyme replacement therapy. The enzyme alpha-Gal A is defective. And what makes complete sense is to give the enzyme back. It is given intravenously every 2 weeks for treatment, and FDA-approved treatment in the US. Now, there's also an oral treatment called the chaperone treatment, migalastat. And this is applicable for only certain mutations that are amenable. And in these cases, the enzyme is there, but it's unstable. And the chaperone goes and stabilizes the enzyme and chaperones it into the lysosome. And then adjunctive therapy to manage the signs and symptoms. For example, if you're spilling protein, then ACE inhibitors and ARBs are a class of drugs that are used. If they have rhythm problems, then they need to see an electrophysiologist, maybe get a pacemaker, and so on and so forth. So once again, going back to multidisciplinary approach. And then we should not forget the investigational, the modulation of the gene expression, whether it by gene editing, gene therapy, or other drugs that modulate the expression of the gene. More enzyme replacement therapies are being studied, chaperone therapies, and substrate reduction therapy. So these are some of it's a very active area of research in Fabry disease. So in summary, Fabry disease is difficult to identify but easy to diagnose in most of the cases. It's a multi-system progressive disease. A multidisciplinary approach is the best approach in managing this complex problem. Supportive care is very important. The entire family needs to be evaluated and treated, and early diagnosis and treatment is key. When we talk about whole family, a point that I want to mention is please don't forget about our female patients. They need to be tested and treated if needed as well. And finally, research will lead the pathway. So with that, thank you very much for attending this presentation. I hope you found this useful, and I will give it back to Dr. Feldman. Thank you very much.
Thank you, Dr. Rastogi, for that excellent presentation. And now we are at the core of the meeting, hearing from all of you. And to lead us through the rest of the meeting, I'm happy to welcome our moderator, Mr. James Valentine. James has worked for the last 14 years as a champion for the patient voice. He previously worked at the FDA, where he was a patient liaison, helping to incorporate the patient voice into the review of medical products. While at the FDA, James helped to develop and launch the Patient-Focused Drug Development Initiative, which became the externally led Patient-Focused Drug Development Program, of which we are a part today. In private practice, James has worked with many patient organizations to ensure their community's voices are heard by decision makers. And relevant to today's meeting, James has helped in planning and has moderated 75% of the over 60 ELP-FDD meetings conducted to date. And he has moderated all 5 of the National Kidney Foundation's previous ELP-FDD meetings. It's a true pleasure to work with and to know James during the last 6 years of ELP-FDD meetings, and so I know we are in the best of hands today. And so I'm happy to now turn the meeting over to James.
Well, thank you so much, David, and it's such a pleasure to get to work with the National Kidney Foundation again and our partner for this meeting, the Fabry Support and Information Group. So now that we've heard a clinical overview from a disease expert, as David mentioned, we now get to turn to the core of today's meeting, which is to hear from you, people living with Fabry disease and their direct caregivers and family members. We've heard that patient-focused drug development is a more systematic way to gather patient perspectives on your condition and on available treatments. As you heard just a little while ago from FDA's Dr. Spoku, your input can help inform the agency's understanding of Fabry to help inform new drug development and review. While FDA's held many of its own PFDD meetings, today marks the 63rd externally led PFDD. With over 7,000 known rare conditions alone, this is truly a unique and important opportunity for this community. So I'm going to tell you a little bit about today's meeting. It's intended to be interactive, so we'll be asking a bit of you throughout, and I'm going to describe what that will look like and how today's meeting will be organized. So first, in this morning, we'll be exploring the patient and caregiver experience with living with Fabry and how it impacts your daily life. When we come back in the afternoon in our second interactive session, we'll bring you together to discuss your experiences with clinical trials and your thoughts about participating in new clinical trials. And finally, in a third session that will close out our meeting, we're going to explore your experiences with various approaches to treatment, and we'll also be asking your preferences for future treatments. So what will these various discussions look like? Well, we'll primarily be using 3 different methods to hear from as many patients and caregivers as possible. We'll start some of our sessions by hearing from panels of patients and caregivers of individuals living with Fabry that will be providing some prepared remarks, which will help set a good foundation for our discussion. And these are individuals that were selected to reflect a range of experiences with Fabry. But we know a single panel of patients and caregivers can't represent that full experience, which is why we'll then be broadening our discussion to all of you who are with us live today in the audience, patients and caregivers tuned in. We'll build on those panel discussions. I'll be asking questions and inviting you to provide comments. This can be done in one of two ways. We'll be providing a phone number that you can call in. We encourage you to dial in by phone, and we'll have an opportunity to have a discussion together and hear your experiences. You can also, you'll see under the live stream that there's a comment box, and so you can provide written comments throughout today's program as well that we'll be sharing live during the meeting. You'll also see that we'll have a Zoom panel of patients and caregivers who will be contributing as well. And then the third way we'll be bringing your voices into the conversation is through the use of polling questions. Patients and caregivers only can use their phone or their web browser on their computer to respond, and we'll be able to see those polling results in real time. You can actually go ahead now and get into this system. We're going to get to some polling questions in just a few moments. But as you'll see, once you get to this webpage, you'll be able to stay there throughout the entire day. And each time a new polling question comes along, it will automatically appear. So at this time, I'll ask that you, for all of our patients and caregivers, pull out your phone, open up a tab on your browser, or open up a browser on your phone, or open up a tab on your web browser if you're following along on your computer, and go to www.pollev.com/Fabry. Again, feel free to go there now, www.pollev.com/Fabry, and we'll be getting to the polling very soon. These polling questions are intended to help broaden the discussion, give us a sense of the experiences of our overall audience, but really to help us think about some of the critical issues we want to hear from you about. After today, there will also be an opportunity to provide written comments for an additional 30 days after the meeting. So whether you maybe shared some things today but had other things that we weren't able to get to, maybe after today's meeting you think of something else that you didn't think to share during the live program, or perhaps you're watching this on demand, the recording, and if you want to provide your comments, we encourage you to as well. All of today's input, as well as this written input, will be summarized in what's called a Voice of the Patient report, the summary of today's meeting, which will be provided to the Food and Drug Administration and made available publicly for researchers and drug developers. So one last thing before we go ahead and get into it and start asking for your input, I want to cover a few ground rules for today's discussion. We encourage individuals with Fabry and their caregivers and family members to contribute to the dialogue through, again, polling questions, calling in by phone, and providing written comments. The discussion is limited to patients, family members, and other direct caregivers only. Our other stakeholders, staff from the FDA, drug developers, and clinicians are here to listen. I also want to mention that views expressed today are inherently personal and recognize that the discussion may get emotional at times. So because of that, respect for one another is paramount. And to that end, we ask that you try to be focused and concise in your comments, so that way we can hear as many voices as possible. So without further ado, let's get into our first set of polling questions. These are some questions just to get a sense of all of our patients and caregivers in the audience who will be responding throughout today's meeting. So again, you can go to your phone, open up that browser, go to that browser tab on your computer, go to pollev.com/Fabry, and we're going to go ahead and start off our questions for today. So our first question is, we want to know, are you either A, an individual with Fabry disease, or B, a caregiver of someone with Fabry disease? And we understand that some of you may be both, in which case we'd like you to answer on behalf of yourself, at least for just the polling questions. When we get to phone calls and written comments, we encourage you to provide both your experiences as both a patient and a caregiver. So this is perhaps the easiest question, but we'll spend a few moments on it just to help make sure everyone has a chance to get into the polling system and answer at pollev.com/Fabry, and let us know, are you an individual living with Fabry disease or a caregiver of someone living with Fabry disease? And caregivers can be family members, close friends, anyone that is involved in the life of the person living with Fabry disease. All right. Well, it looks like the vast majority of our participants today are individuals living with Fabry disease, although again, we recognize that some or maybe even many of you are also caregivers of someone with Fabry disease, although we do want to recognize that we do have some of you that are caregivers and not individuals with Fabry. I want to encourage you to participate in our discussions today as well. Your observations and experiences are very important to help us understand what it is to live with Fabry. If we go to our second polling question. So here we want to know, where do you or your loved one with Fabry live? The options are A, the U.S. East Coast, B, the U.S. Midwest, C, the U.S. West, D, U.S. West Coast, E for Canada, F, Mexico and the Caribbean islands, or G, somewhere outside of North America, some other region or country outside of North America. And this meeting is open to anyone from around the globe, so wherever you're tuned in from, we want to hear your voices as part of this conversation as well. All right. While any final responses trickle in, it looks like the majority of our participation is from the U.S. East Coast. We hopefully as the morning hours progress on the West Coast, we'll get some more participation from there. But it does look like we have good representation from the Midwest as well as the West. And we do have some representation from outside of North America. So again, welcome to those of you who are joining us from outside of this continent, and we look forward to hearing your voices today. If we go to our third polling question. So here we want to know if you're a person with Fabry, what's your age? Or if you're a caregiver, what's your loved one's age? So the age of the person with Fabry. The options are A, birth to 1 year of age, B, age 2 to 12, C, age 13 to 17, D, age 18 to 29, E, age 30 to 39, F, 40 to 49, G, 50 to 59, H, 60 to 69, or I, 70 or greater. So if you're a caregiver, what's the age of your loved one? If you are a patient, what is your age? Again, just to get a sense of some of who are in our audience, we recognize some of you may be representing both yourself and maybe a child with Fabry. We are asking that you answer these on behalf of yourself for these questions. So as it stands, it looks like we have a good spread across every adult age range, starting at age 18 all the way through the 70 or greater, with the greatest representation from those that are 50 to 59 and 60 to 69. No one is currently reporting to be here to be a person that's younger than age 18 or a caregiver of someone under age 18. But again, we also recognize that some of you are both caregivers and patients. So may be able to bring in those current day pediatric experiences as well. If we go to our fourth polling question. Here we want to know, do you or your loved one with Fabry identify as A, male, B, female, C, binary or non-gender conforming, or D, if you prefer not to say? So this is, if you're living with Fabry, are you male, or do you identify as male, female, non-binary, or non-gender conforming? Prefer not to say. Or if you're a caregiver, please answer this for the person for whom you care. So while we still have some results trickling in, it looks like we have a greater representation, about 75% of our audience representing females with Fabry, and about a quarter representing those who are male. No one reporting either non-binary or non-gender conforming or preferring not to say. All right, we have one more question here, again, just to get a sense of our audience and who we have participating. If we go to our fifth polling question. Just stand by one moment while we get our fifth polling question. All right, so here we want to know is what is the length of time since your or your loved one's Fabry diagnosis? The options here are A, less than 1 year, B, 1 to 2 years, C, 3 to 5 years, D, 6 to 10 years, E, more than 10 years, or F, I'm not sure. So here we want to know, again, that length of time since your Fabry or diagnosis or your loved one's Fabry diagnosis. All right, well, we'll give a few more moments here to get responses in. We see them bouncing around a little bit still. I think it's clear that most of our audience, the vast majority of our audience, themselves have been diagnosed for more than 10 years, although we do see some representation for those who have been diagnosed for 6 to 10 years, as well as 3 to 5 years. No one currently reporting shorter than that, although again, we've asked those who are living with Fabry, who are also caregivers, to respond on behalf of themselves, so we may hear some of those more recent diagnosed stories in today's meeting. All right, so with those polling questions out of the way, I want to thank you all for participating in those. It's great to just get a sense of who we have. Now we're going to go into that first discussion topic of the day on what helping us understand and learn what it is to live with Fabry. So I'm going to call up our first set of discussion questions. These are questions that we hope you'll help answer for us on the disease symptoms and daily impacts of Fabry. So here we want to know, of all the symptoms that you experience because of your condition, which 1 to 3 of these symptoms have the most significant impact on your life? We know there are many different symptoms and health effects of Fabry, but we need you to help us understand which are impacting you in your life the most. We also want to know, are there specific activities that are important to you, but that you cannot do at all or as fully as you would like because of your condition? We also want to know, how has your condition and its symptoms changed over time? So whether that's changes that you experience day to day, week to week, month to month, or even over the course of years or maybe even decades. And finally, we're going to want to know what worries you the most about your condition, thinking about your future living with Fabry. So to get us started on this topic, I'd like to welcome our first panel of your peers, patients and caregivers who will be helping answer some of these questions. We have Kim, Rowena, Paige, and Caitlin. Kim, take it away.
My name is Kim. I'm 53 years old and live outside of New York City in Maplewood, New Jersey, with my husband and 2 boys. For work, I'm a leader of human resources for an investment bank in the city. I was diagnosed with Fabry disease at birth in 1969 because my father was diagnosed when my mother was pregnant with me. He was referred to a dermatologist due to a large amount of the angiokeratomas on his trunk, and that led to his own diagnosis. All his teen symptoms of pain and fever finally made sense. It quickly progressed to kidney failure in his early 30s. His brother also died suddenly from Fabry at age 34 of a stroke. Fabry disease is multi-generational, and I'm just one of 7 in my family known to have or are suffering from this disease. I watched my father in a constant state of health crisis, endless pain and suffering, with his body and mind deteriorating. At age 52, he called me at college to tell me that he was giving up to suicide. In my early 30s, I was told that my symptoms meant that I was not just a carrier, I'm also burdened with the progression of the disease. It all made more sense for me as well that I experienced terrible burning pain in my hands and feet and unexplained fevers than when I was a teen as well. I often took very uncomfortable cold baths to bring down my temperature, which would relieve the burning. And I was often out sick and unable to participate in sports teams, even my gym class. My pediatrician didn't believe me, and some thought I was just lazy and unmotivated. I was told to just push through the pain and keep going. I married in my 30s and shared a love for being outdoors, hiking, skiing, camping, and fishing with my husband. He's very active recreationally, and I try to keep up, but the burning pain and fatigue keep me from the more rigorous activities. We started a family, and in my first pregnancy, I had the baby tested in utero for the disease. I'll never forget receiving the devastating call that he had Fabry. We hoped that treatment would be available for him early as a child. We didn't want to take a chance with our second, so I went through the arduous and expensive process of IVF and pre-implantation genetic diagnoses to ensure that he wouldn't have it, and I'm happy to say it worked. My second pregnancy, however, came with more heart rhythm irregularities, like frequent low and high heart rate changes, dizziness, and arrhythmia, as well as sharp stabbing pain in my heart and brain. I also started spilling more protein in my urine and had unrelenting fatigue. In 2010, after multiple emergency room visits for heart rhythm problems, I was diagnosed with atrial fibrillation. I had medical procedures, but still experienced hundreds of premature atrial and ventricular contractions daily, and constantly I worry when I feel out of breath. I also have stage 1 heart block, some dizziness, and mild left ventricle hypertrophy, according to my regular testing. And I have even more difficulty exerting myself now in exercise and recreational activities, particularly with progressive lung obstruction from Fabry that causes daily coughing. In 2018, at age 48, I had a brain MRI that showed white matter changes. 6 months later, I suffered an acute ischemic stroke. My husband found me that awful morning, unable to speak with limited movement on my right side. It was very fortunate that it was within the critical window of time, but I was unable to work for 6 months while in rehab. And still to this day, I have some lingering memory, word recall, and processing deficiencies. My professional life and maintaining some income security and insurance for the family has been a big part of my life. I suffer from extremity pain and relentless fatigue daily, and most days feel like a zombie. My work performance at times has suffered, and I overcompensate with a strong work ethic, but wonder really how long can I keep it up? Knowing how critical the 5th and 6th decades of life are for progression of women with Fabry, and knowing that I've hit all the unfortunate milestones so far, makes the fear paralyzing at times with this terminal illness. My 18-year-old son represents hope. He's never missed a dose of ERT since he was a toddler and has managed to find the energy to play moderate sports and achieve at school. But he's more tired than his peers. He has plaguing gastrointestinal problems common with Fabry, and he worries what will come with the disease. For me, having just turned 1 year older than my father made it with this disease, I hope to be here longer to see a better future for my son.
Hello, my name is Rowena. My husband and I have been married for 16 years and are a blended family with a total of 7 kids. My 24-year-old son from a previous marriage and my 10-year-old daughter that my husband and I share also have this disease. Fortunately, my daughter currently shows no signs of Fabry. My son's symptoms differ from mine. He started feeling symptoms of tiredness and stomach aches when he was a teenager, but at 18 years old, started to experience a higher level of pain, often treated with prescribed pain medication. Without his daily dose of pain medicine, my son has difficulty going about his day. Something as simple as getting up to go to work would be quite the chore. What more when he delivers packages to multiple businesses? Throughout the day, he would feel aches and pains from every joint. As a child, I had fever and chills often. Doctors often misdiagnosed me with having juvenile arthritis or thought it was just growing pains. Finally, I was officially diagnosed 15 years ago when I had a Fabry crisis. It was a cold day in December, and snow had fallen the day before. I remember going to the store, dressed in sweats, pants, and boots. I remember feeling chilled to the bone and could not get warm. Suddenly, I felt drained and had to close my eyes and lay down. The next thing I knew, I had a fever. I could barely move, drifted in and out of sleep. When I looked in the mirror, my entire face was swollen. That had never happened before. That was when my primary care doctor introduced me to my nephrologist. My husband and I work full-time and our lives are very busy. A typical day for me begins as early as 9 a.m. when I reach for the weather channel so I know how to dress for the day. This sounds really trivial, but it is very important for me because of the temperature sensitivity I experience from Fabry. This is the symptom that bothers me most, as it is a daily reminder that I have Fabry disease. The weather here in Washington State is mild, with a lot of rain mixed throughout the year. 75 degrees with a mixture of sunshine and a little cloud is ideal for me. The slightest change in temperature, however, even 2 to 4 degrees, will upset my body. As I get older, I've noticed that heat and cold intolerance worsens over time. It takes longer for me to balance out. Although I rarely sweat, I find that it is easier to cool down from being too hot than to warm up after being cold. I can take a wet towel over my neck and grab an ice cold drink to cool down and stay out of the heat. However, being in an air-conditioned room for me too long gets tricky. A normal person can warm up or cool down in less than 5 minutes. For me, it will take hours. Washingtonians are often advised, especially those new to the state, to dress in layers so you can take off and put on clothing as needed. I do that and more. In my car, I have a heavy jacket with gloves stored inside the pockets. And in my classroom, a blazer hangs over my chair. I'm often seen wearing a cardigan even during summer. While my body tries to recover from an episode of temperature fluctuation, it works overtime and causes fatigue. Sometimes I am chilled for too long. I feel the onset of flu-like symptoms along with arthritic-like pain in my hands and feet. Eventually, whatever I have planned for the rest of the day starts to fall off my schedule. I cancel planned dinners, outings with my kids. I go home, take a nap if I have to, and shut the world away. Fabry has impacted my life with something as simple as feeling a draft when someone walks into the room while I am in the shower. Being diagnosed so many years ago and regularly going for 6-hour infusions of Fabrazyme every 2 weeks has helped minimize the worsening of symptoms. When I miss a scheduled infusion, my body reacts. I become more sensitive to temperature changes, easily fatigued, and pain becomes heightened. I used to overextend myself and attend every activity, every event, so as to not disappoint myself, my family, and my friends. However, that did me no good. My body would rebel. It takes time, even years, to learn these lessons. So I do what I can by being prepared first thing in the morning. I reach for my weather, dress in layers, check off my daily to-dos, and go about my day.
Hi, my name is Paige DeRusso. I'm 17 years old and live in Baton Rouge, Louisiana. I am a senior in high school. My dad was diagnosed with Fabry before I was born, so my parents always knew I had the gene. When I was born, the geneticist told my parents I would be an asymptomatic carrier, and would live a normal life. I started having unexplained fevers, crying spells, and abdominal pain at just a year and a half. My parents, who were both doctors, believed what the geneticist had told them and searched for other causes of my symptoms. This led to a lot of doctor and hospital visits with no real answers. I was diagnosed with strep, flu, kidney infections, and many other illnesses that didn't seem to fit just right. It got to the point that my parents and the doctors all thought I had anxiety or psychological problems and sent me to see a psychiatrist. My symptoms continued on and off. As a competitive cheerleader, I would get overheated very easily. I loved cheerleading, but the older I got, the less I was able to tolerate the strenuous exercise. I eventually quit due to the stress on my body. My symptoms were so nonspecific and hard to pinpoint that my coaches, my teachers, and even my family questioned whether this was really Fabry or if I was just doing things for attention. In 2020, when I was 14 years old, I started with a fever crisis that lasted for 35 days. For an entire month, I had fevers. I took ibuprofen, Aleve, and Tylenol every day, but nothing brought down my fever. I saw doctors and went to the hospital, but no one could find anything wrong. I didn't leave the house and I missed a month of school. Every time I would try and go to school, my fever would go up and I would have to go home. Lucky for me, a few weeks later, everyone got sent home from school due to COVID. This is when my parents suspected that the geneticist who told them I would be an asymptomatic carrier was wrong. I wasn't crazy or just a difficult child. I was really sick. I started Fabry infusions. No one could say for sure if my symptoms were due to Fabry. My local geneticist said the fevers weren't related. I became so sick that I couldn't even do virtual school, and I almost failed out. I had previously been a straight A student in honor classes. I missed out on normal high school experiences and even had to cancel my own birthday party 2 years in a row. I ran fever while taking the ACT for my high school and had to go home immediately after. I became so consistently sick that I felt like I would never get better. It took about 18 months on Fabry for me to be somewhat normal again. We do my infusions at home so I won't miss school. I am back to in-person school and missed only 20 days last year. That is a huge accomplishment for me. I still have fevers, vomiting, and headaches several days per week, but at least they aren't every day. The worst part of having Fabry is not all of the pain or the things I miss out on, but being unreliable. In general, I am a very organized type A person. I like to be on time. I'm a planner. But Fabry has made my life unpredictable. I cannot tell my neighbor I will babysit on Friday because I may be vomiting uncontrollably. I cannot plan to go to the movies with my friends next weekend because I never know what tomorrow will bring. I'm not a reliable student, a reliable employee, or even a reliable friend, even when I try my best to be. Right now, I'm looking at colleges. Having Fabry complicates my decisions. There are so many factors that normal kids don't have to take into account. Like, will my insurance cover me at college? Who will do my infusions? Will the infusions work out with my schedule? As I look to the future, I pray for Fabry treatment options that will allow me to just be more normal.
My name is Caitlin. I live in Massachusetts with my husband, my 2 sons, ages 8 and 6, and my 2 dogs, and I am 37 years old. For as long as I can remember, Fabry disease has been a part of my life. Growing up, there were over 15 family members of mine that had Fabry. I watched my father suffer daily with pain, life-altering GI symptoms, extreme fatigue, hearing loss, and more. I watched as he received 2 kidney transplants from family members, and I watched as he passed away from heart failure on Christmas Eve, 2016, at the age of 59. Due to Fabry, he had to miss out on events and activities in our lives, and now he'll miss out on watching his grandchildren grow up too. When I was younger, the first symptom that I remember experiencing was burning in my hands and feet when I was sick and when I had a fever. I remember standing in my kitchen during one of those episodes and accidentally dropping a cold sponge on my foot. That sponge felt like a knife going straight through to the floor because of the sensitivity in my burning feet and the cold temperature coming into contact with them. Growing up, I had mild symptoms and was still able to participate in the activities that I wanted to. And today at age 37, I still experience similar symptoms that have progressed since childhood. I still experience burning hands and feet during a fever, but now in addition to full body pain, that significantly limits what I'm able to do until it passes. I've had ringing in my ears for as long as I can remember. I thought it was normal, actually, and that everyone had those sounds in their head. I have occasional gastrointestinal symptoms, including severe stomach pain, diarrhea, and constipation. And during these episodes, I'm hesitant to leave my house or even to eat. I also experience occasional headaches and migraines that can last for 2 to 3 days and leave me laying down with my eyes closed until they pass. My organs are also affected. In the past, I've had protein in my urine, but 5 years of Fabrazyme has seemed to stabilize my kidney function for the time being. I also experience heart palpitations that can come out of nowhere and catch me off guard at my job or during a work meeting. I also have an incomplete right bundle branch block and a low heart rate that may or may not cause issues in the future. One of the most substantial ways that Fabry affects my everyday life is the constant responsibility of staying on top of my health. I see a geneticist, a cardiologist, a nephrologist, a neurologist, a therapist, and an ophthalmologist, in addition to the regular doctors for somebody my age. Calling these offices to schedule appointments, waiting to hear back from the doctors, keeping track of my tests and procedures and when and how often I need to have them done is like a second full-time job. It's exhausting, and Fabry is always on my mind. Currently, my mental health symptoms are much more impactful on my everyday life than my physical symptoms. I suffer from anxiety, and every single day I wonder, what if? What if my kidneys fail? What if I need a pacemaker in my 30s? What if I have a stroke? What if the pain gets worse and I'm unable to work, since that's the only way that I can get life insurance? And I'm always waiting for lab results and test results. It produces a constant state of worry that something's going to come back this time and something's going to be really wrong. Mental health symptoms are symptoms that don't seem to be on the radar as much when it comes to Fabry disease, but I know I'm not the only one who asks myself these questions. My 8-year-old also has Fabry. He has been on Fabrazyme for almost 2 years. This means that every 2 weeks, this 8-year-old child has to sit for hours with an IV in his arm, causing him to miss school, interrupting his life, and affecting his ability to live as a typical 8-year-old. Even with the early treatment, his symptoms are starting to evolve. He has occasional hand and foot pain, especially when he's outside in cold weather and comes in to warm up. His sweating is minimal, so flushed cheeks and overheating are things that we have to constantly watch out for, especially in these hot months. He sometimes needs to use the bathroom soon after eating for a bowel movement, and he has stomach pain occasionally. He already has some angiokeratomas on his belly button. He's also an amazing person, and he is the strongest 8-year-old that I have ever met. So all of these worries that I talked about before, I worry for him too. I wonder what his years will look like, how his social life will be, but more so his mental health, if there will be effective treatments and a cure in his lifetime. And that feeling of guilt that I have every single day can be crippling.
Wow, Caitlin, thank you so much, and to all of our panelists for being so brave to share your and your loved ones' stories of living with Fabry. And I know it takes a lot to do that, and being first to do so in today's program, we're so grateful for that. So this is now the first time we have an opportunity to expand and welcome the rest of you who are in our live program to share via your experiences of living with Fabry, the symptoms, impacts in daily life. And we want to encourage you to both call in and write in throughout this morning program. If you'd like to call in and share your experiences, we welcome you to. That number is 1-703-844-3231. Again, that number you can call in is 1-703-844-3231. We'll get you set up and in the queue. That way we can bring you into the conversation. You can also look to that comment box that's under the live stream today on the webpage you're currently on. You can enter in your comments there, and we'll be reading those throughout today's program. But to get a sense of our audience and get you all thinking about this topic of the different symptoms and health effects of Fabry, we're going to go to some polling questions to get us started. So go ahead, if you were with us earlier, you can go to that same page you already had up. If you're just joining us, this is for patients and caregivers only. Go to www.pollev.com/Fabry, and you'll be able to answer these questions throughout today's program. Just keep this page up throughout the day. So our first question for you this morning is, have you experienced, or if you're a caregiver, has your loved one experienced any of the following Fabry-related, disease-related difficulties? And we want you to select all that apply. We know that there's many, that's why there's many options here, but the options are A, pain in feet or hands, B, kidney problems, C, high blood pressure, D, heart problems or stroke, E, hearing problems, F, lung or breathing problems, G, heat and or cold intolerance, H, anxiety and or depression, I, brain fog or feeling of forgetfulness, or having poor concentration, J, fatigue or the feeling of being tired or exhausted, K, GI issues. We know there's a number of different possible GI issues. L, skin issues. M, swelling, such as in the ankles or feet. N, some other symptom or health effect that's not listed. Or O, if you or your loved one with Fabry does not have any symptoms. All right, so this is our first polling question where our respondents in the audience can pick more than one option. So what you're seeing is a percentage of total responses, not a percentage of people who picked any one response. So you can think of these bars as kind of a relative ranking from one another. We'll give people time to answer this. I know there's a lot of selections to pick from, but as it stands, it looks like some of the top most common disease difficulties experienced by our audience is fatigue, as well as heart problems or stroke, pain in feet and hands, and GI issues. We kind of see after that, and pretty close second, hearing problems, kidney problems, anxiety, depression, and brain fog. What's really noteworthy is just how much every single one of these, none of these are really low relative to one another. So we see that, people with Fabry are experiencing many disease-related difficulties all at once, and I think that's evidence from some of our panel statements we heard, and just the number of different specialists they need to see. I'll also call out that we see a number of people reporting other. We do want to hear about those other things that maybe are less commonly experienced. That is very relevant. And we do see that maybe there's one or a few people who have not experienced any symptoms. So if we can go to our second polling question, now that you've let us know what all different things you've experienced or your loved one experienced, here we want to know of those same symptoms and health effects, which are most negatively impact your daily life and are not adequately addressed by your current treatments. And we want you to pick up to 3. So here we want, amongst those same things, for you to select the top 3 that most negatively impact your daily life. And it's all of the same response options from the polling question we just answered. So we'll give you a few moments to think about this. Some of these things get a little bit trickier to pick just three when there's so many of these things I know can be debilitating and troublesome. So again, we'll give you a few more moments here. We've still got responses coming in. And similarly, this is a percentage of responses, not people responding. All right, it looks like responses are slowing down here. So as it stands, at least, it looks like perhaps some of the top most impactful symptoms are the heat and cold intolerance, the heart problems and stroke, hearing problems, the feeling of fatigue, and anxiety and depression. What is really standing out is, that each of the things we have listed are in some or perhaps even many people's top three most significant in terms of impacting daily life. So while kind of consistent with the previous polling question where so many things were selected by so many, we're also seeing that it's not always the same few symptoms that are most impacting people negatively. So regardless of whether you pick something that's a little lower ranking here, like high blood pressure or lung and breathing problems, or something that's a top thing that's listed here, like those heart problems or the heat and cold intolerance, we want to hear why you picked what you picked. That's really what's going to help us understand your experiences the most. So to help us do that, I'd like now to welcome our Zoom panel. These are some of your peers living with Fabry or caregivers of people living with Fabry who are going to be sharing their perspectives along with the rest of you today. I'd like to start maybe with Debbie. Debbie, as you're thinking about that wide range of different impacts of Fabry, which one or a couple of those would you say is most troublesome in daily life?
I'm Debbie. I'm from Ann Arbor, Michigan, and I am 60 years old. I was diagnosed with Fabry disease when I was 10. For me, the hearing part is really, really hard for me. I finally, about 10 years ago, had to get 2 hearing aids for my ears because I couldn't hear very well. It impacts my job. I am a teacher, and so I need to be able to hear when people are talking to me. It was hard with my 2 children when I couldn't hear what they were saying. That was really difficult for me. The hearing aids help a lot, but it still is a struggle at times. The other thing that's really hard for me right now is my heart health. I've been having a lot of issues with AFib and of course, the left chamber of my heart is enlarged. It's the one that makes me worry the most, I have to say.
Sure. So I'd like to maybe learn a little bit more about those, 2 particular impacts. First, on the hearing loss, you mentioned that you've needed to have bilateral hearing aids for some time now. Is that something that progressively got worse leading up to needing hearing aids, and has that continued to worsen over time?
It has continued to worsen. It certainly got worse as I got over the age of 45, I would say. But even when I was a child and I had hearing tests, I had hearing loss.
Okay.
In fact, one person, I grew up on a farm, and one audiologist asked my mother if I'd been standing next to the tractor. But yeah, it definitely has gotten worse.
Sure. And did that impact you even when you were a kid? And you said it's gotten worse over time. But even when you were a kid, was that impacting you in school with peers?
I certainly had to work harder to hear at school and to hear my friends talk. I think it just became, oh, she doesn't hear very well.
I see.
And they would speak louder, but it gives you kind of a sense of incompleteness or you're not quite as good as the other kids because you can't hear as well.
I see. And on the, heart condition, I know you said that's something that worries you the most. Is that currently impacting kind of how you feel, what you're able to do currently, or is that more of just a worry for the future?
So it does impact me, I think, because like many of the people who have spoken today, there are physical things I cannot do. My family and I just went on a vacation to Colorado, and it's very hard that I can't hike with the rest of them when they go hiking, or could just do what they do.
Yeah.
I don't think that's just my heart issue,
Sure.
but it does affect my life that way.
Yeah, absolutely.
And I often wonder, both of my grandmothers, or my grandmother who had Fabry, excuse me, she died of a stroke. And so I'm always wondering, when is that going to happen?
Yeah, I can't imagine. Well, thank you so much, Debbie. I want to bring Chris into the conversation, the same topic. There's so many different symptoms and health effects in Fabry. Which are most troublesome for you?
Hey, good morning, everyone. My name is Chris. I'm from Fairfield, Connecticut. I was diagnosed in 1987 when I was about 16 with Fabry disease. For me, definitely, among many of them, for me, definitely, it's been the kidney health. I've had 3 transplants since that time, and the most recent just over a year ago. And these were all deceased donors. And throughout that period as well, stretches of dialysis ranging from 6 months to upwards of 4 years.
Wow.
In the various, both hemodialysis and peritoneal dialysis. So for me, that's been the biggest impact on my life and my family and my friends who have supported me and dealt with all that with me. And sometimes it's hard to distinguish where the kidney symptoms or conditions start and the Fabry symptoms end, or vice versa, along with that, because it's also interrelated. But that definitely for me, that's been the biggest challenge.
Sure. And which of those symptoms are you referring to that you experienced, that it's kind of, is it the kidney symptom or is it other Fabry?
Right. So blood pressure, GI issues, related heart issues. The kidneys are so involved in the entire, your entire body, that my heart symptoms could be family, it could be Fabry, it could be kidney related. And then just the others that I mentioned, the GI, fatigue. I mean, the fatigue could be Fabry, it obviously is. It could be the medicine I'm taking, it could be all of them. So It's hard to really say with any clarity, but then it's very subjective as well.
Sure. Prior to your first transplant and end-stage renal disease, can you maybe tell us a little bit, what did you notice that there was any worsening of symptoms leading up to that? And when did that occur relative to your diagnosis at age 16?
So I was diagnosed in 16, and then by age 20, by age 19 to 20, I'd been on dialysis for a year.
Wow.
And then I got my first transplant at age 21. So a very short period of time.
Wow.
I always consider myself fairly asymptomatic. I didn't experience a lot of problems, heat or skin or pain attacks or anything like that. I never, and to an extent still to this day, don't really have those issues. So I always, to an extent, I kind of called myself lucky, because these terrible symptoms which so many people struggle with, which sounds so awful, both among the panel and the testimony I heard earlier, I didn't really have those. As I'm getting older, maybe I'm starting to get some more of those.
Sure. And maybe can you give us a current kind of status on your kidney health, just knowing your history?
Sure. So it's hard to compare again, and it's subjective, but I feel better than I really ever have as far back as I can remember to 16, or maybe to my first dialysis run. A lot of energy. The kidney's doing very well. I'm very lucky. It was a very good match. I still have, I get foot pain and I have heart issues and things like that. So that's all. I'm doing very well. But obviously there's these other concerns, kind of like Debbie mentioned, that, going down the road, heart and brain related issues. So I'm very lucky and very blessed and very happy, right now in this moment today and in general.
Sure. Well, thank you so much, Chris, for sharing that, and I'm sure we'll be talking more about some of these issues. I do see, though, we have a phone caller, so I would like to bring Kim from New Jersey into this conversation. She will be providing her perspective as a caregiver. So, Kim, I'd like to welcome you to the program. Are you with us?
I am. Can you hear me?
Yes, we can hear you.
Okay, great. Thanks. So mine was, I think, one of the first videos or one of the earlier videos you guys saw. And I was watching all the videos, and I saw Paige's video, and it struck a chord with me that I thought it was worth a call in to talk a little bit about being a caregiver.
Yes.
I'm a caregiver and a Fabry patient.
Okay.
And I have an 18-year-old son who just started college. And I think it's sort of, you can't underestimate what it takes to be a parent in caring for a Fabry patient, going through a schooling system and school, whether it's, primary school or college, trying to figure out how to manage a chronic illness and accommodations, and some of the things that Paige spoke about, missing school, attendance issues. And most schools, especially public schools, aren't really set up for handling, chronic long-term illnesses.
Sure.
And particularly if you're seeking treatment, which my son did so early, having to miss school because, nursing services don't happen on the weekends. So, and then with college, making those decisions, it's not sort of the scenario where you're just looking at grades and test scores to decide where to apply, but you have to factor in things like what schools can I work with to help him manage this disease remotely, and he's taking on that responsibility for the first time himself in the, all the supplies and medication and ordering, and it's a lot for any, new college freshman. So I can't, and when I see on the sort of, group Fabry support pages where people are hesitating to seek treatment for their kids, for the difficulty in disruption that it will cause. So I just wanted to put it out there in hearing Paige's, from Paige's perspective on her and her parents, sort of journey in dealing with all of this. It's a lot.
Yeah, well, I appreciate you, Kim, kind of adding on, and we love to hear that, into each person's kind of personal experience with some of these, similar things. I do want to query a little bit about your son. You mentioned some of the challenges of coordinating, of schooling and doing that around coordinating care. But I'd kind of be interested to hear about how that also interplays with, maybe those most troublesome symptoms or health effects at the same time. Were there, was he also missing school, from any of those symptoms or health effects, or, difficulty getting accommodations with some of that?
Yes. Yeah. He certainly had a lot of and still has a lot of gastrointestinal disruption that is, plaguing for him to get to school. There were times where he'd just be late because he was in the bathroom and his stomach was upset just from eating a little bit of breakfast, so his first class had a lot of attendance issues. There were times where I had to pick him up and take him home because he either had an accident or he just didn't want to go to the bathroom there at the public school. And I think that was a lot of the early times. And then the pain with school, like he had his gym class, in the middle of the day. So we'd try to get schedule switched once he got to high school, and there was flexibility in that schedule to get his gym class at the end of the day so that he could attend all his academics before he did physical activity that would give him a lot of pain.
Oh, wow.
And so those were some of the symptomatic things. And, the fatigue was always present.
Right.
But then there was also the times when we sort of forged the way in our school district for remote attendance before the pandemic happened. So that was another thing that we had to do to help with accommodations when he either couldn't make it
Right.
or he had treatment. And the district was very reluctant to have that type of access.
Right.
But, you know, through even leading to litigation, you know, we almost got one of those robots to be able to have him
Right. Yeah.
there. But we used just, you know, sort of Google Remote, but it worked.
Right. And Kim,
it wasn't ideal, but it worked.
just to give us a sense of the scope of these impacts, you know, on maybe in a given month, you know, how many days would he be late or miss class, you know, maybe through high school, you know, again, just to give us a sense.
Well, he met the maximum of 20 absences in a year, and there were a lot of late. I think it added up to you could have like 15 lates that equated to an absence, and he just met the max. So per month, I'd say at least a couple times a week.
Right. Wow. Well, Kim, thank you so much for calling in and adding here. It's you know, really valuable to hear about your son's experiences, and you know, we do want to hear about these challenges and impacts, you know, how this translates to impacts in life. And so thank you for sharing about his experiences, you know, and yours in navigating, you know, kind of the school system and schooling. I want to come back to our Zoom panel here and bring Michelle into the conversation as we're exploring different symptoms and health effects and those that maybe are the most troublesome. Michelle, what stands out to you?
Hi, everyone. My name is Michelle, and I live in New Jersey. I've had symptoms of Fabry my entire life. I was diagnosed 14 years ago at the age of 36 by a kidney biopsy. With genetic testing of my family, we know I'm a random mutation. I am the only one in my family with Fabry. And the few symptoms, because I've had symptoms my entire life, have been the fatigue and the intolerance to heat and the pain, that becoming overheated, or when I had a fever, that was just, you know, very painful during my life.
Wow. And you know, kind of those different things, you know, whether in the past or today, you know, what would you say is the ones that have been most troublesome for you to kind of navigate or deal with?
I would say the fatigue, just going through school and, you know, having a hard time in gym class and not being able to play outside with kids. And then, you know, as I got older, you know, not going to football games during high school because I was in bed, and during, you know, college, having a very limited social life because I would go to classes and, you know, do my schoolwork and be in bed early. And that's really has gone through, you know, my adulthood in socializing with people. And, you know, now I have to cancel dinner plans or don't make dinner plans because I know I'm going to have a busy week and I'm just going to have to take care of myself and rest. So not being with people is also isolating, which can also lead, you know, and make my depression, you know, worse, just not being around people.
Yeah, and Michelle, you know, as you think about your fatigue, you know, is this something that it's kind of you wake up and you know, oh, I'm fatigued from the start of the day, or is it something that more kind of onsets as the day goes on, and maybe you don't know how bad the fatigue will be, you know, until later in the day? Just to help us understand, you know, how you experience it.
I know immediately if I've not had a 9-hour solid sleep that I'm going to be dragging through the day. And in the past few years now, I've had to work part-time, and sometimes I'll work for a few hours and then just sit on the couch and I'll fall asleep in the middle of the day, which has never been like that. Or there's days that I know I'll be able to get up and do things for a few hours, and then I'll just take a nap because the fatigue is just there during the day. And I do a lot of planning of when I'm going to do my errands, you know, based on weather and based on how I'm going to feel and how many appointments I have during the week or what I have on my calendar. But the fatigue is always something that I just plan around,
Yeah.
or try to plan around, because I never know how in the morning I'm going to feel, or what the weather is going to trigger that day, or could trigger.
Oh, sure. And are there periods of time, whether it's only a day at a time, one day to the next, or 1 week to the next, where, you have good, more good days versus bad days? Does it all, you kind of mentioned weather, does it change from season to season? How many good and bad days you have?
It does. This past summer in New Jersey, we were extremely warm, as most of the country was, and we had several heat waves that lasted not just 3 or 4 days, but several days. And there were days where I would take 2 steps out of my house to check my mail, and that was it. And just being inside in the air conditioning, I could tell that I was just more fatigued, and it just zapped all of my energy. And when they say check on your neighbors and the elderly, like, I could feel it just staying indoors. But there were a few stretches this summer that literally I was inside my house for days because of the heat.
Oh, wow. Wow. Well, thank you so much, Michelle, for sharing that. I do want to just put out a pitch that if you would like to share your experiences, these symptoms and health effects, and how they're impacting your daily life, just to remind you, you can call in at 1-703-844-3231. Again, that's 1-703-844-3231. You also can write in with comments in the comment box under your live stream. In fact, I see that we have been getting a number of comments. So, David, I know you're monitoring that. What are we seeing?
Right, James. Trina from Clarksville, Indiana, writes in and says, it's hard to pick the worst symptom, as there are so many symptoms with Fabry disease, but I feel if my fatigue, pain, and depression could be controlled, that it would significantly improve my life. I'm single and have to work and provide for my family, and that is my biggest struggle. With the chronic fatigue, I fall asleep at work, while on the phone, sometimes while talking to people, sometimes while on hold. I think that's a really clear example of how fatigue can negatively affect in this disease.
Absolutely.
Kim from Boston writes, I have found that anxiety and depression are also dependent on many of these other physical manifestations that we experience. It's very hard to be a positive person if you're experiencing brain fog, exhaustion, and chronic pain. And Catherine from Alabama writes, I'm a patient and caregiver as well, and I agree that it's very hard to try to allow your child a normal life and manage this disease. I've had to have my son's school put a 504 plan in place to protect him from failing due to missing school and needing more time for assignments, missing for infusions or doctor's appointments. So you see, immediately how this disease is affecting multiple areas of people's lives.
Yeah, and then kind of this theme that we're already starting to hear, it's a combination of managing and balancing the disease itself and care.
Right.
And we'll be talking a lot this afternoon about participating in trials, about what our current approaches to treatment are and what they involve. So we're going to be, kind of talking very specifically about that part of it. But, it's very interesting already to hear that, they're very interrelated, and that they're both, competing in terms of the impacts that they're having on people's lives. So I'd like to broaden the discussion a little bit. We've already started to hear about how these symptoms and health effects are impacting your lives and your daily, those activities in your daily life. So we have a couple of polling questions, though, to kind of get us thinking a little bit more about this topic. And then, of course, we want to hear from you, calling in and writing in to help us further understand how Fabry impacts activities in daily life. But let's go ahead and go to some polling questions. Pull your phone back out and go to that browser, go to that tab you have open, go to pollev.com/Fabry. Again, that's www.pollev.com/Fabry. If you've been with us, you know that if you just keep this web page open, as we go to different polling questions throughout the day, it will automatically appear there. So just keep this open, and we'll be periodically asking you to help respond. So our question for you right now is, how much does your Fabry disease impact your daily life in general? So that range of those different symptoms and health effects that we've been talking about, kind of overall, how would you rate the impact it has on your life? The options here are A, not at all, B, minimally, C, moderately, or D, a significant amount. And as you're thinking about this, think about what is it that's standing out, that's making you, choose, say, moderate over either minimal or significant. Is it one symptom? Is it many symptoms? We want to hear from you in terms of understanding this kind of rating of how Fabry disease is impacting your daily life. So here, it looks like a little over half of our respondents are saying that Fabry is impacting their or their loved one's daily life moderately. A little under a third are reporting that it's impacting their life a significant amount. And then we see around 5% reporting both that it either impacts their lives minimally or not at all. So regardless of where you fall on this spectrum, we want to hear from you in terms of what are the impacts, why do you report them where you are, and what symptoms and health effects are driving that. If we go to our next polling question. So here, now we want to kind of dig in a little deeper and start to think about, which activities, types of things in your life are most impacted. So here, which of the following statements are true for you as related to living with Fabry or your loved one living with Fabry if you're a caregiver, and select all that apply. The statements are A, my general activities in daily life are limited. B, I miss work or school more than I'd like or cannot go at all. C, I cannot fully participate in sports or other physical activities. D, I cannot fully participate in other hobbies. E, I feel isolated from family and or friends. F, I am not as independent as I would like to be. G, others don't know what it's like to live with Fabry disease. And H, none of the above. If your life is not impacted by Fabry disease, you can select that option. Just as a reminder, since there's multiple, our audience can select multiple responses. These are percentages of responses, not the percentage of people picking any one response. All right, well, any final responses are trickling in. We still want you to get those in. At least as it stands, it looks like one of the things that's most commonly selected as being true amongst our audience is that others don't know what it's like to live with Fabry disease. We'd very much like to hear kind of what that means for you, how that impacts your life, not having the people around you understand what it is to live with the condition. We see after that perhaps the next top true statement, or most commonly true statement, being that I cannot fully participate in sports or other physical activities. We've already started to hear a little bit about this, but we'd like to understand what symptom or symptoms makes it difficult to participate in these types of physical activities, how that's changed over time in your life. We see that feeling isolated is fairly high, as well as just general activities in daily life. Maybe some of the things that most people might take for granted. We'd like to hear how those are impacted. But really, we're seeing every single one of these things being true for many of our participants. So we want to, hear what those are, and perhaps, which of these are the most important to you that are impacted. And then we do see that some are reporting, consistent with what we've been seeing, that there are some people who currently do not experience symptoms, and so their life is not really currently impacted by Fabry disease. So now I'd like to come back to our Zoom. Before I do, just another reminder, please call in, write in. We want to hear about your experiences of those impacts in daily life. That phone number being 1703-844-3231. We'd love to be able to hear, and as with previous callers, have a little bit of a discussion about that. So if we could go to Donna maybe to kick us off on this topic, in terms of, those activities that are important, which of those maybe can you not do at all or as fully as you would like?
Hi, I'm Donna. I live in Texas, and I'm probably the oldest one on this call. I'm 76 years old, and I'm reflecting on how your poll questions are stated. It talks about how does Fabry affect your daily life. I would say my experience is that Fabry defines my daily life, meaning, not in a bad way, that over these long years of Fabry disease, I have tailored a life that excludes the things that I can't do. And largely for me, the number one thing is the combination of two symptoms. Because of the enlarged heart and the insufficient perspiration, heat and exertion are out of the question. As a result, I don't take those physical fitness classes that are so important to aging well. And that's a concern to me, that I'm not doing the right things for myself because it's the wrong thing for myself to do the right thing. The second thing is I'm at an age and stage in life now. Someday when I retire and I finish with the kids, I'm going to travel. And Debbie said it earlier. And so you start to go places. And what you find is typically you have a range of opportunities when you visit places. I happen to like to see the world, and I travel as far as I can, as often as I can. Yes. But my immersion into those places I go is fairly limited to the more sedentary ways of experiencing it. I don't hike, I don't bike, I don't even walk with exertion. My good day is when it's cool, I can walk a certain amount at a certain pace, and the distance is correlated to the pace. Thinking of it differently, I'm the person in your tour group who's always at the end huffing and puffing when you're thinking, why doesn't she keep herself in shape? I'm a drag on a tour. I'm a drag with people who are outdoor people. As a consequence, my friendships are defined by those who are not hikers, or not bikers, or not athletic people. My friends, I have nothing, I can't be in common, I can't be in activities with others. So there's the shorter answer is Fabry has defined my life because I've tailored it to leave out those things I can't do, those people I can't enjoy life with.
Yeah, and
I'm not complaining. I've had a fabulous life, but
no, absolutely, and I think you stated it really well. You've kind of shaped your life, to accommodate those things that you can do. I would just like to maybe understand a little bit. Thinking back over the decades, in your experience with Fabry. Currently you mentioned that it's in the enlarged heart and the lack of adequate perspiration that's really driving that. Has that always been the kind of driving key symptoms for you? And how did you maybe first know or recognize that you needed to make those kind of accommodations or change what it is that you are doing in your life? Kind of when was that, and what did that first look like?
Okay, it's very clear to me looking back. When I was in 8th grade, I went to summer camp with some friends, and it was a quote primitive camp. And believe me, I'm not a camper, but I learned from that. But one of the activities was a scavenger hunt, and we had to go collect things, and we each took a thing, and it was competitive with other tents. I took the assignment to run down to the base camp and get the signature of the camp nurse. I ran as fast as I could, heat, summer, run back up, presented the signature of the nurse, and promptly passed out.
Wow.
Then I played field hockey in high school, 9th through 12th grade. And invariably, once per season, I passed out. it was so commonplace that I would actually hear people on the team yelling, "She's going down again."
Oh man.
That was just my normal. And so the next thing you know, they're putting cold on me. Okay, my father died when I was 17. Had a heart attack when he was 40, died of kidney failure at 43.
Wow.
You would think this would tip us all off to something, but no, there was a mystery. Nobody knew why daddy died. Fast forward, and I'm now 40 years later at age 57, I was diagnosed with Fabry disease. And that's when I began to see the symptoms looking back. But what did I do when I was passing out? Well, I stopped running. I stopped engaging in things that would bring on that feeling. Over time, I continued to moderate back because I'd find out that just a rigorous workout session.
Right.
I remember going to some kind of a dancercise class. I couldn't dancercise with the rest of the class. I was a mess. So the thing is, I look back, and it was the symptoms were there,
Right.
but it was my normal. As my mother would say, my sister also has Fabry disease because our father did.
Yeah.
I hope she's not listening. She's going to hate me for this. My mother would say, Donna has lousy lungs and Debbie has loose bowels. It was just how we were defined.
Wow. Yeah. Well, Donna, you mentioned, we've been talking a lot about kind of the impacts on what you can do physically, but something that really stood out from what you were talking about is how that's not only changed what you can do, but, who you can do it with, or the people who you have in your life. Kind of along those lines, how did you navigate as you kind of were putting the pieces of the puzzle together and eventually getting that diagnosis? How did that impact family relationships, social relationships, to the point where you are today, and do have people that in your life that kind of align and match with your interests and what you can do?
Well, that's exactly what happens. The people who are in my life are the ones that align. There's one very specific example where my inability, there was a prospective romantic situation, but the man was an outdoorsman, couldn't wait. From the moment the sun came up, he was outside, hiking, biking, doing as much as he could.
Right.
I couldn't participate. I made the attempt to. And it was a deal breaker.
Right.
I mean, amongst other things, but there wasn't enough shared interest. So the simple answer is there's a whole set of activities that one cannot have as a shared interest, and you can't therefore be with those people for whom that's a big part of their lives.
Absolutely.
As a result, as soon as I find out somebody is an outdoors person, I don't mean to shun them, but I just don't go in that direction. I can't even do something as simple as, let's get up and do morning walks. And the reason is, and I can't be dependent on. If it's a hot day, I might have to go slow. Really, for me, it materializes now with almost an anxiety. It is an anxiety, not almost, that when I'm traveling and I know there are going to be group tours and excursions,
right,
I get a lot of anxiety about, will I be that one at the end of the trip again, dragging people waiting for me while I'm huffing, puffing, turning red. And there's nothing like that red face that a Fabry person gets when you're just short of passing out. And it scares others. The answer is it's very defining of who you're with, and it becomes a deal breaker that you can't be with certain people.
Yeah, well, Donna, that's extremely helpful. Thank you so much for sharing all of.
Thing I have to add.
Oh yeah, please do.
So when you're traveling, you get to this age, and by the way, thank God you get to this age with Fabry disease. ERTs while you're traveling, taking your infusions with you. Oh my God. Whole different panel discussion for a different day.
Not for a different day. We actually will have a panel discussion about that later today, but yes.
Oh my God, trying to take 10 doses for a 5-month absence.
Well, thank you, Donna. I do want to bring Carol in. I know we haven't heard from you yet. There's so much to talk about, in terms of the impacts of Fabry in daily life. So I'd like to hear your perspective on this.
Hi, Marshall and Dr. Feldman, thank you for inviting me. I'm sorry earlier, my screen just
Oh, no worries.
totally went blank. So I'm just catching up now to you. Thank you for the invitation. My name is Carol. I'm 59 years old and I live in Ocala, Florida. And what was your question again?
Yeah, no worries whatsoever. And thanks for hopping back on to Zoom. I know, it's not a virtual meeting if there's not some kind of technical snafu. So just we're thinking about, of all the different, activities that might be important to you, are there any that either you can't do at all or as fully as you would like because of the different symptoms of Fabry?
I'm one of the lucky ones. I'm able to do, of course, all the indoor activities and outdoor activities too. I don't have any heat intolerance, which I'm very fortunate about, but I do have cold intolerance. And so one of my favorite sports that I like playing is pickleball. And up in Ocala, which is Central Florida, it does get cold up here. So like 20, 30 degrees. So I have a really difficult time playing outdoor sports, especially pickleball when it's very cold out. The neuropathy in my hand is what really bothers me to the point where it's hard for me to play.
Yeah, and has that always been kind of one of those most troublesome kind of signs or symptoms for you, that neuropathy in your hand and the cold intolerance, or is that something that's maybe been more recent in your life?
It's more recent. I would say in the past 10 years. My earlier childhood age, I don't recall any problems with cold or heat intolerance. So I would say it's gradual and for about 10 years now.
Right. And I know you say you're one of the lucky ones, and I know a lot of people, say that relative to each other in your community, but I know that still there's, the impacts are still big and impact to life, so just thinking in terms of, other, to put it in perspective for us, other symptoms that maybe you experience. Can you tell us, what besides the neuropathy and cold intolerance you've experienced over the years?
Well, just over the years, it really wasn't no problem. It's just more recently. For example, if I go in a restaurant, it's very cold. It's like I have to bring a jacket, and I'm wearing gloves a lot of times, and people always joke around, oh, it's cold because Carol has a jacket. And I don't really share my Fabry symptoms with other people, just, within my family and a very small circle of friends. With me, I look at Fabry's, I don't want anybody to feel sorry for me, so I just kind of keep it to myself.
I gotcha. Well, thank you so much, Carol, for sharing. I see we have a caller, Sabina from Pennsylvania, who referring to that polling question, that thing that was reported as one of the top true statements for our audience of others not knowing what it's like to live with Fabry. I know Sabina wants to share her experience and what that looks like in her life. So I'd like to welcome Sabina to the program. Are you with us?
Yes, thank you for having me. Yes, I as you stated, I was really, I've been struck. Well, one, listening to the panelists and listening to, or just hearing the other comments that are being made with the presentations. I mean, it is clear and it is evident that Fabry patients and care partners are strong people. We're resilient people. So I guess one of the things that kind of just, so many different things kind of the comments have just mirrored my personal experiences. But one thing that, as you stated, has stood out to me was the fact that people feel that others don't understand what we're going through.
Right.
I think it's a key point, and I think that also can pour into the anxiety and depression. As many people, as Donna was saying, many things that that we experience become our norm, right?
Right.
So we don't even recognize it at first. We may not recognize it as this symptom or this issue in our daily activities is brought on by Fabry. But I think it's difficult when you become that person that is constantly missing, whether as a teen, missing school, missing class, missing certain activities, but also just missing work or just slowing down in your work production. I think that's a difficult point, and I think that leads to isolation.
Right.
That leads to anxiety. The feeling that you need to keep up. You need to keep up appearances because we don't want to let Fabry disease define us, but it is a very real part of us. So it just kind of struck a chord with me when I saw how many people had responded to that particular question.
Yeah, and Sabina, so I'd like to maybe probe a little bit and, thinking in your own life, where that's played out, you kind of talked, that might impact, relationships with family or friends. It might impact, your, kind of the workplace. Can you think of an example of in your own life where, that kind of played out and that, not people not understanding what it's like to live with Fabry really, in some way impacted, that part of your life?
Yes. Now, I have to preface this, saying that I'm very fortunate. We do have a very strong, loving, supportive family that works together to care for each other and to support each other. We have several family members that are impacted directly by the disease, as well as several of our children. But I just feel like sometimes at work, for instance, I have a very, very, it's a very visible position at my work, and I'm dealing with a lot of people every day, and I kind of have to feel that I have to be up, meaning I have to have a smile on my face. I need to be a very on top of things, organizing everything, and some days are just so difficult. And while I am fortunate to have a very supportive work environment, it's just very difficult for me to always be saying, oh, I need this time off or I need to work from home. I think a lot of it is my personality because I'm very driven, but it is difficult because I can see that it wears, I don't want to become a burden. I don't want my responsibilities to fall into the hands of others. I also see that with my kids, my raising my teenagers and one having Fabry disease and one other that is also medically complex. Mm-hmm. I see the same frustrations with them where they've had to tell their boyfriend or their friends that they can't do something, and it's because of Fabry. And it's very difficult just trying to re-explain it all in all. I mean, people just don't understand Fabry. If I said that I had a broken leg or I had some other very well-known disease, then I think people are more understanding. But it can be very wearing and just cause a lot of frustration and lead to depression as well.
Absolutely. Well, thank you so much, Sabina, for calling in and sharing and kind of building on what we saw so prominently in the polling questions. We have another caller. We have Mark from New Orleans, who's a caregiver to both his wife and son with Fabry, that would like to share some of their experiences. So Mark, I'd like to welcome you to the program. Are you with us?
Hey, how you doing?
Doing well.
Yes, I'm from right outside of New Orleans, Louisiana, and I have a 7-year-old son with Fabry and my wife also. Mm-hmm. And I guess I was just going to kind of give my input on how it affects us.
Yes.
And I would say both my wife and son at this point is maybe more mild than some people, but it does affect our daily, weekly lives. And my son already has kidney damage. Mm-hmm. He had kidney damage early on, so he started Fabrazyme at 4 years old.
Okay.
And also my son, my wife was spilling protein while she was pregnant, so they had to take my son early. Mm. So he has mild cerebral palsy.
Wow.
So he's weak on his left side, which that adds on to how everything affects our daily lives.
Right.
But with my son, he has the temperature sensitivity. And like I said, he's been on infusion since he was 4. And GI issues, both of them. But it's kind of like trying to stick with my son, I guess. He's been having that since a very young age.
Okay.
And, so I guess as a caregiver, I see, like with my son, it's, I guess, the beginning of all of these little things. He has hearing loss in his left ear to where he's even been, the doctors have said they're absolutely open to putting a hearing aid in his ear for school.
Okay.
And his teachers have had to, we opted to not do that quite yet. So his teacher, like last year, wore, I guess, a microphone during class.
Wow.
So, I mean, between the kidney damage, hearing loss, infusions, temperature insensitivity, everything we plan almost with him is around temperatures and weather.
Right.
To give an example, we took the kids to Disney World last year. We went during April because we knew he couldn't take the heat during the summer.
Right.
And all of our activities are based around that. We bring children's Tylenol with this constant, anything we do, just in case pain in his feet, because that has started to kick in.
Okay.
Just in case that kicks in while we're doing our outing. So it affects our daily lives in different ways. And I know that this is kind of the start. It's
right.
mild for where it's probably going to go.
Yeah. Well, Mark, thank you so much for calling in, and it's I think really important to hear. You shared both your wife and your sons, but a little bit more of your son's experiences, and just seeing how so many things impact him already. Even though maybe individually those things are just the start. Already collectively having such a big impact. I do see that we've gotten some written comments coming in. David, are we seeing anything on this topic of impacts on daily life?
Yes, in fact, Trina, who wrote in before about fatigue, is writing in again. And Trina, thank you for writing in twice. Trina writes, there are days I'm in so much pain or so nauseous or doubled over because of stomach issues that even when I was working from home, I would have to miss. Employers aren't willing to keep people, so then the depression hits worse. No job, can't take care of myself or my family, and for some unknown reason, you can't get disability for Fabry disease. So, this is again really affecting people's lives in a lot of different areas.
Wow. Well, thank you for writing in, and I want to just encourage people to call in and write in throughout the whole program today. We'll continue to bring your voices into the discussion, just as we have for everyone who has done so far. So with just the little bit of time we have left in this morning session, I do want to recognize that you all really made an impression on all of the different range of symptoms that you are experiencing, the multitude of ways that has impacting your lives. But I also recognize that you're thinking about your lives and your futures living with Fabry disease. And so I do want to explore, what are your greatest worries and concerns for the future? And to bring your voices into that, we're going to have our last polling question of this morning's session. So please go to that web browser, that on your phone, that tab on your computer, go to pollev.com/Fabry. Here we want to know what worries you the most about your condition in the future, and you can select your top 3 greatest worries. A, that your symptoms will get worse. B, that new symptoms will appear. C, the worry of not being able to live independently. D, the worry of not being able to attend school or work or pursue a career as you would like. E, that your social and family relationships will suffer. F, that you will progress to end-stage kidney or heart disease or heart or kidney failure. G, transient ischemic attack or TIA or stroke event. Or H, some other worry that you have about your condition in the future that's not otherwise listed in one of the other response options. So again, please select up to the top 3 greatest worries that you have for the future. All right, give you a few more moments here to get your responses in. Again, these percentages are the percentages of total responses we're seeing. So these bars are essentially kind of relative rankings. And we're seeing that, a few things are really rising to the top as some of the greatest worries. You're worried that your symptoms are going to get worse. You're worried that you may not be able to live independently in the future. You're worried that you'll have a TIA or stroke or progress to end-stage kidney or heart disease and failure. While some of those are some of the top greatest worries you have, we do see that in others' top three, you are worried about new symptoms appearing, about not being able to work or go to school as you would like, as much as you would like or at all, and that your social and family relationships will suffer. And we are seeing some people say that there's some other worries that they have that are some of their top worries about living with Fabry in the future, and we want to hear what those are too. So I'd like to encourage you, if you would like to share your comments on this topic of worries for the future, you can call in at 1-703-844-3231. You can also submit a written comment in that comment box under the live stream below. But I'd like to see if maybe with coming to our Zoom panel, with a little wave of a hand, who from our panel might want to start us off and contribute here on thoughts about worries, greatest worries and concerns for the future. Any takers from our Zoom panel? Yes, Donna.
Well, first off, I'll preface it by saying I try not to worry because it's a useless attempt to control things over which you have no control.
Sure.
Nevertheless, the realities of the disease you can't be in denial.
Mm-hmm.
And perhaps it's because I am now at the age I am, that I do think about what end of life will look like. And the thing that I think most worries me is that left ventricular hypertrophy, the enlarged heart, is thought to double the risk of dementia and cognitive impairment, and to increase the risk for stroke. So while I don't worry about it, I have an awareness of being enfeebled.
Yes.
I don't have a fear of death. It would almost be better to die from the heart failure than to have the stroke or the cognitive impairments. And I do think about that. And of course, there are other causes of that, but the fact that left ventricular hypertrophy doubles the risk makes me cognizant that I must make the plans now with an assumption of that outcome.
Right. Yeah.
So that I am not going to become the burden to my family.
Absolutely. Well, thank you so much, Donna, for sharing that. And that's not something we had, it's kind of a downstream impact that, we haven't heard yet in terms of the impacts of Fabry. And so, thank you for sharing that concern for the future. Anyone else on our Zoom panel here would like to share their greatest worry or concern for the future? All right.
I hope I didn't cause somebody to worry now.
No. Debbie, how about you? Yes.
Yeah. I do have a worry for my kids.
Yes.
My kids, neither one of my children have Fabry's disease, so that's my huge blessing. But I do worry about them when I get older, what they feel they're going to have to do for me.
Yes.
Like Donna said, I guess my greatest fear is to be incapacitated and have to have somebody care for me. I think they would do it willingly and lovingly. It's not that, but you just hate to think that that would be something that your children would have to do later in your life.
Yeah, a worry of becoming a burden. Yeah. Well, now I just want to thank all of you on our Zoom panel. You've contributed so much throughout the discussion, and to everyone that's called in and written in. We're hitting that mark where we need to wrap up this morning discussion, but this will not be the end of our input from all of you today. What we're going to do is we're going to take a 1 hour lunch break, so we will resume at 1:05 Eastern Time. What we'll be doing when we return is building on this really rich discussion we've had this morning, where you've helped us understand what it is to live with Fabry, and then be exploring Your experiences and thoughts and preferences are first about clinical trials and participating in them. And then second, your current treatment approaches. We've already started to hear a little bit about that this morning and what you're looking for from future treatments. So we encourage you all to join us back in 1 hour. We'll hope that you'll call in, write in, answer polling questions, and help us understand your experiences with that. With that, we're going to go to a break. Hello, good afternoon, and welcome back to the externally led patient-focused drug development meeting on Fabry disease. My name is James Valentine, and I'm your moderator for today's meeting, and I'm here with David Feldman from the National Kidney Foundation as my co-host. We had a wonderful discussion this morning about what it is to live with Fabry. This afternoon, we have a pair of discussions where we're going to build on that. First, understanding your experiences with and preferences around clinical trials, and then expanding into that, talking about your experiences with current treatments and preferences for future treatments. But before we get to those discussions, we have a speaker presentation for you. I'm going to pitch over to David to introduce our afternoon speaker. David?
Thanks, James. It's a pleasure to introduce Dr. Eric Wallace. Dr. Wallace is a nephrologist at the University of Alabama at Birmingham, where he is the medical director of the Rare Genetic Kidney Disease Clinic and of the Fabry Disease Clinic. Dr. Wallace is an expert in Fabry disease, and he will now speak on the challenges to performing clinical trials in Fabry disease. Dr. Wallace.
Well, I really appreciate that introduction. I'm Eric Wallace. I'm the medical director of the Rare Genetic Kidney Disease Clinic at UAB with a primary focus in Fabry disease. And today we're going to discuss the challenges to clinical trial designs for Fabry disease. These are my disclosures. So why does it matter that we have excellent clinical trials as it relates to rare disease in general? And really, this is a really important question. So clinical trials are the only way to ensure the best care and understanding of risk and benefit of any new drug that comes to market for the care of rare disease patients. The cost of doing clinical trials in general is astronomical. So the design of these trials must get it right the first time. You don't have money to keep repeating the same clinical trial with different endpoints. You got to get it right the first time because these are extremely expensive. The outcomes have to be clearly measurable and they have to be clinically important. So what's the risk? What if we do it wrong? Well, I mean, the risk if we do clinical trials inappropriately is that we could approve drugs that don't work, or just as importantly, we might not approve drugs that do work. So really important that we get clinical trials correct. So what's the best clinical trial design? Well, you need a representative patient population, and then you randomize that population to either new therapy versus standard of care or placebo. And then at the end of testing the new therapy versus standard of care or placebo, what you do is you see, did it make a difference in some outcome? What did it make better? So let's just talk about the challenges of each one of these parts. So the representative patient population. So the problem with this is that this is a rare disease. So Fabry disease is a rare disease, and you have to have participants to do a clinical trial. So the incidence of classic mutations is about 1 in 40,000. So that's the reported incidence in the general population. Now we know that there's actually more Fabry disease than 1 in 40,000 if you do newborn screening studies, which multiple states are doing now. It's more like 1 in 9,000, but this number of 1 in 9,000 includes variants. So you start getting a mixed picture of the people who are going to represent the patient population for the clinical trial. Finally, since it's a rare disease, you want to make sure that everyone who wishes to participate in clinical trials wants to participate. Unfortunately, some of our markers, and we'll talk about these in just a minute, are actually histologic markers or biopsies. Well, the more invasive procedures that are done with clinical studies, even less people want to participate in the clinical trial. So you got to get participants, and it's hard in rare disease. So now, once you get your patient population, let's say you have a group of patients, what is the patient population you want to study? So in Fabry disease, this is an X-linked disease. And clearly, because males only have one X, their presentation is a little bit more predictable than that of females. So now, females are not carriers, so we need to discuss them. But if you're only going to do a clinical trial in the male population because their disease progression is a little bit more predictable, the question is number one, you're going to have less patients to participate. And the other question is how does the results in an all-male trial now correlate with how this is going to behave in a female Fabry population? So is it truly generalizable if we only use males to study the disease? Now, females, when you include females, you get a larger sample size, so you get more patients that can participate, but phenotypic variation, or how females presents, is actually quite varied. So you have female patients who are severe and female patients who are not severe. So how does this translate into actually demonstrating a measurable difference when you have a lot of variation in your patient population? Ultimately, what it means is although you have more numbers to participate in your clinical trial, you actually need more numbers to show a demonstrable difference in the outcome. Finally, there's over 1,000 mutations that have been identified in the GLA gene, which is the gene that causes Fabry disease. But some of these present very differently. You have classic mutations, late onset mutations, cardiac, renal variants. Who do you include? How do you know this is a representative group when the presentations are very varied? And then finally, young or old. So does the age of the patient in the study actually make a difference? And it turns out the answer is probably it does. If you have a much younger population, those disease manifestations are different, and the progression can be different than those who start at an older age. So what is a representative patient population when we talk about Fabry disease? Time at initiation of therapy also is important. So is someone who starts a clinical trial after 10 years of our standard of care, is that the same as someone who starts as a patient who has never had any therapy? And right now, we kind of lump these all together. But once again, we have to have a representative patient population to demonstrate an outcome. So now, we talked about the problems with the representative patient population, but what about standard of care or placebo? What is the standard of care as it relates to Fabry disease? So currently we have two FDA-approved medications. We have agalsidase beta and migalastat. So have patients been on this therapy? Have they been compliant with the therapy? So many clinical trial designs want to show that something that has been getting worse now either halts or gets better. Well, if a patient has been receiving standard of care but has been non-compliant for many reasons, is that a patient population that now can represent a generalized patient population? We have Fabry adjunctive therapy like ACE inhibition, anti-neuropathic pain medications, and GI medications. And depending on the prescriber and the expertise of the physician that is now taking care of these patients, patients may be on these adjunctive therapies and they may not be. They may be optimized on adjunctive therapies or they may not be. So how do we actually standardize care when we know that all patients may be on different levels of Fabry adjunctive therapy? When we talk about standard of care, well, what number of visits is standard? Is a Fabry patient who was being taken care of but only being seen once every 3 years, are they in a standard of care arm? And frequently what we see in trials, not just with Fabry disease, is you have a patient who is actually receiving quote unquote the standard of care, but the reality is they were receiving substandard care, and now they enter into a clinical trial and they get better just because they are now receiving the standard of care. So that is another effect that we have to take into account when the standard of care is not well defined. Although there are guidelines, there are varying degrees of standard of care when it comes to Fabry disease. And then finally, most Fabry experts believe that patients should be seen by a multidisciplinary team, including cardiology, nephrology, et cetera. Well, many patients haven't seen all of these subspecialists. So what is the standard of care and how many visits should a patient have been seen before we say they are a representative patient population? So difficult to say what is the standard of care and difficult to find patients who we say have been in standard of care. Now, finally, one of the hardest things is the differences in a well-defined marker. So what do we measure to say that we have actually made a difference? So Fabry disease is a multisystemic disease. It takes years to manifest. And what does it affect? Well, it affects the central nervous system, peripheral nervous system, kidneys, heart, GI, skin, eyes. I mean, it affects everything. So what are we going to measure to say this drug made a difference? So we have biomarkers. Lyso-Gl3 and GL3, this is the stuff that builds up in Fabry disease, can be measured. We can show demonstrable reductions with therapy. These markers, however, haven't been validated longitudinally in long-term outcomes. So we call these soft markers, but they are important in measuring for sure. Creatinine and eGFR, so as a nephrologist, very important to measure the decline in kidney function. However, in order to demonstrate a true difference in decline in kidney function, we tend to need large numbers of patients, which we just said was very hard to get. And that's largely due to some of the variations. So small variations in creatinine can mean large variations in estimated GFR. So it's inherent to the marker of why we need larger numbers to show a real difference in decline in eGFR. Troponin is another measurable outcome, but the problem is that troponin is a heart marker. It's easily measurable, but in hypertrophic cardiomyopathy, it doesn't tend to change with therapy. So there are issues with even our best of biomarkers. Important work that's been done to establish these, but is this enough to prove that a medication will work long-term? Imaging, so we can say, so Fabry disease affects the heart. In general, the heart will get larger and scar in the heart will progress as the disease progresses. One of the things we do to measure the heart is echocardiograms, but Dr. Moon, who is one of the foremost experts in cardiology and Fabry disease, it does a very eloquent job of demonstrating how much variability there is in echocardiogram reads intra-observer. So trying to truly determine if something has changed with echocardiography has inherent error with it. So cardiac MRI tends to be a much better measure of changes in cardiac function than echocardiograms. However, it's expensive, and when you're doing clinical trials, you need as many sites as can participate to participate. So many centers don't have access to routine cardiac MRIs, which can limit the amount of trial sites needed to do excellent studies in rare disease and Fabry disease in particular. Brain MRI, another marker, which is you can measure changes in white matter function. That may be something, but once again, hard to determine small changes in using volumetric imaging of brain MRI for patients. So histology. Histology is a good marker, which is that we can actually see the reduction in global triacylceramide in the lysosomes of these cells in Fabry disease. But the problem is that they're invasive. So not many people sign up for studies that say, hey, I'm okay with you sticking needles in me. Much less when you say in order to demonstrate a difference, you don't need one biopsy, you need two biopsies. So one at the beginning and one at a variable time point. So we can do kidney biopsies, heart biopsies, skin biopsies. But when you're already dealing with a rare disease population and you need people to enroll in the study, anything that includes multiple biopsies is going to limit your interest of participants in participating in that study. So histology is very important, but also has its limitations. So patient-reported outcomes is another measure in Fabry studies. This is also difficult to collect because pain can be very variable. Even the timing of the pain can be variable. So it's a hard outcome to collect. Despite the challenges, we have to move the science forward. There's many unmet needs, including cardiac, brain, uncontrolled pain, antibodies, and tolerability of therapy in general. So in conclusion, we need to improve the identification of patients and link these patients to centers of excellence. If we do a better job of identifying patients with Fabry disease, we will increase the patient numbers that can participate in clinical trials. And this is the number one thing that is needed to do good clinical trials. It's patient numbers. And so I can't stress that enough, improved identification of patients. We need to improve communication of clinical trials to participants to make sure they know that there are clinical trials in their disease. We have to continue to search for biomarkers that correlate with long-term outcomes. There are definitely still unmet needs. And so the needs for good clinical trials in Fabry disease is incredibly important. And so one thing that has to be gleaned from all of this is that whatever we determine now doesn't just affect the current generation of patient, it affects the next generation and the next generation and the next generation. And so we need to do it not only for the existing Fabry population, but for every generation of Fabry patients that come along. They're really counting on us to do a good job with the clinical trials now. And with that, back to the studio.
Thank you, Dr. Wallace, for that great discussion of the current status of designing clinical trials in Fabry and some of the challenges, and really for providing that clinical researcher perspective. Now that we've heard that presentation, we want to expand the discussion to all of our patients, people living with Fabry, and their caregivers, because as Dr. Wallace described, it's important that we have clinical trials that are trials that you all would want to enroll in. And so we're going to be talking about a number of different issues around your experiences and preferences for trials. So if we can pull up our discussion questions for this session, over the next live discussion period, we're going to be asking you to tell us a little bit about your trial experience and whether you'd participate. We want to know if you knew a clinical trial was planned for Fabry disease, what information would you want to know to inform your decision in enrolling in that trial? We also would want to know, would you be interested in participating in a trial for a drug that's designed to do one of the following, even if it did not slow or stop the overall disease progression? Would you be interested in a trial that would benefit the kidney alone, a trial for a drug that would benefit the heart alone, or perhaps a drug that would help reduce symptoms such as pain, GI involvement, fatigue, and just those symptoms, again, without being a drug that would slow or stop overall disease progression. And then for our parents and other caregivers of pediatric patients, we're interested in hearing from you. Are you interested in enrolling your child in a clinical trial? If so, what factors would you consider in deciding whether to participate? For example, your child's age, whether their symptoms have already begun, or whether they're already on a treatment like ERT. And if not, why are you not currently interested in enrolling your child in a clinical trial? So if you have, whether or not you have experience in a clinical trial in the past, certainly if you have, we'd love to hear your real world experiences from what you've already kind of been through in terms of being in a trial. Or even if you haven't, we want to hear, what your perspectives are, what would make you more or less interested in participating in a clinical trial. We'd like for you to share your thoughts. So you can do that by calling in. The phone number for calling in is 1-703-844-3231. Again, you can call, share your thoughts on clinical trials at 1-703-844-3231. Alternatively, you can also submit written comments in that comment form under the live stream, and we'll be reading those out throughout the program as well. But to get us all thinking about it and to get a sense of our audience, we have a polling question that we're going to start out with. So if at this point, for those of you who have been with us in the morning, you already know you can go to that browser on your phone. You can go to that tab you have opened on your computer. Go to www.pollev.com/Fabry. Again, that's www.pollev.com/Fabry. Keep this page up for the remainder of the afternoon. Whenever we go to a new polling question, it will automatically appear there, and you'll be able to answer the questions. So our first question for this session on clinical trials is, of the following factors related to a test drug in a clinical trial, please select up to 5 that you rank as the most important to your decision about participating. I know there's quite a few considerations here, so we're hoping that you can narrow it down to the top 5 most important. The options are A, whether you might get a placebo, sometimes known as a sugar pill, as part of participating. B, whether you would need to stop your current treatment before enrolling in the trial. C, whether you would need to stop your current treatment during the trial. D, the potential side effects from the trial drug. E, whether specific benefits from the drug have been seen to date in earlier trials. F, how the drug is taken, whether, for example, whether it's going to be by mouth, an infusion, or an injection in the muscle. G, the frequency of the trial's exam appointments. H, the distance to the trial site. I, the length or duration of the trial. J, whether a kidney, heart, or skin biopsy is required. K, whether you may be ineligible to participate in future trials by participating in this current trial. L, whether active drug is provided in a trial extension phase. So after the portion where you may be getting placebo, whether or not you would have that opportunity to roll over onto drug. M, whether your physician recommends enrolling in the trial. Or N, some other important consideration that you would rate as one of your top 5 most important in a decision to participate in a clinical trial that's not otherwise listed here. So this is our first question of the afternoon, where our respondents can pick more than one option. So I'll just remind our audience that we're seeing a percentage of total responses, not a percentage of people that are selecting any one response. So please think of these bars as kind of a relative ranking or rating. So as it stands, while final results are trickling in, it looks like the top most important factor in determining whether to participate in a trial would be the potential side effects from the trial drug. That's followed perhaps by whether you'd be getting placebo, how the drug is taken, and whether your doctor recommends it. We see close behind that whether you need to stop your current drug during the trial or before the trial, as well as whether a biopsy would be needed or whether it might make you ineligible for future trials. We do see that every single option here is in some number of people's top 5 most important factors. So what we want to do is we want to hear from you. You know, as you were answering this question, how did you weigh these different things? Is this something that's informed a past decision of whether to not participate in a trial, or is something that would apply to future trials? So to help us think through some of these topics and share some of their experiences, I'd like to welcome our Zoom panel. Please, if you do want to share, you can call in and write in. But maybe to kick us off, we can start with you, Sabina. As you were looking at that whole list of different considerations, what stood out to you as some of the most important ones, and why did you pick those?
Well, hello, and thank you for having me, David and James. My name is Sabina, and I am calling in from Pennsylvania. I was fortunate enough to be part of a clinical trial over a 12-year period, beginning with a phase 2 as a phase 2 participant, all the way through fruition and FDA approval. So I've kind of seen the whole gambit, as well as I've also had my daughter as a pediatric participant. It's interesting when you looking at that list, it's very, very difficult to pick the top 5. Yes. Because going into a clinical trial, you really have to consider so many different things. My first thing was, one, getting on the trial, because the inclusion and exclusion criteria can sometimes be difficult. And as Dr. Wallace had said, he had mentioned several things to really to build the success of a trial. And the biggest part is, can the participants actually participate? Right. So the trial design, I know a few of those choices on the list were number of appointments and length of the trial, and whether or not travel is involved. So I think a big thing for me, I was fortunate to be able to handle them, and it was an extensive trial and did did require travel, but being able to participate and just removing the barriers for patients, because so many patients, especially in the rare disease world, and Fabry patients in particular, want to participate, but if they can't, because of simple barriers, just the logistics of the trial, I think it's quite difficult.
Yeah. Well, thank you for that kind of introductory thoughts. I do want to maybe dig into a little bit of your experience and kind of help give us some color around what you just shared. I guess one, you mentioned, the distance to travel, the amount of visits, in that 12-year study that you were involved in. How often were you? Did you have visits in that? Did that, maybe was it different in the beginning versus longer follow-up? And how far were you traveling for each of those?
Well, I traveled, my travel was over several states, so it did require flights. And in the beginning of phase 2, when they were really focused in on the safety of the drug, it was quite invasive. Several biopsies, several cardiac MRIs, brain MRIs, all types of tests, everything from skin sweat tests to pulmonary function tests. And as the trial went into extension trials and had developed more, and they were able to gather more information, it did ease up. Because at first I was going, I think I went once a month, then I had several right in the beginning, then it was once a month, then it was once every 3 months, then it was down to once every 6 months.
Okay.
I probably had a total of 45 to 50 flights, which again is not the norm. Most people are not in a position to be able to take time off from work or find childcare. I was very fortunate to do a lot of juggling and have a very supportive family, but I know that is not the case for most people.
Sure. So if you were presented with a similar trial, today, for a new therapy, is that something that you'd be willing to go through again?
Well, I think a lot has changed since I first started, and with that, the thought of remote trials or the decentralized trials, where I don't think that the option, or I should say, people didn't explore the option of having trials set in your own hometown or getting a blood draw. I mean, several of the visits, the flights, I would fly down to the different state. I would make the flight and I would literally be in the clinic for an hour just to get a medical history, do an EKG and a blood draw. Very simple things that could have been done in my hometown, would have saved time, money, and again, would have reduced the barriers that are put up for so many participants.
Yeah, so it'd make you much more likely to agree if you could cut down on some of that burden.
Yes.
Or some of that. Okay. Well, thank you, Sabina. I'd like to circle around to Karen here. Karen, same question, and I know that was a huge list of different considerations, factors that might be more or less important to you personally. What stands out to you as being some of the top factors around trial participation?
Well, I think most of the factors that I really put into play is, how is this going to help me? And is it going to make a change in my life, or can I help somebody else? So in my situation, I started out doing an oral pill, for kind of to substitute the infusions. And one of the, I went to the trial location, and it was important to me that I had an open communication with the clinical doctor and all the people that were there, because unless you do that, you're not going to get any answers, or, you have to have open communication all the time.
Sure.
The other thing that's very important to me is that, what are the results? Okay. And at the end of the trial, the one trial is still ongoing. I did phase 1 and phase 2.
Okay.
But not unfortunately, but fortunately, the clinical doctor realized that I needed a heart transplant. And if it wasn't for the clinical doctor, we don't know that I would be here today. So I had a heart transplant within 8 months of phase 2 of the clinical trial.
Incredible.
So to me, it's important that the clinical doctor is in tune with you and in tune with your own doctors at your location.
Sure.
Let's see, what else? I think that's about it. Those are the items that are important to me.
Yeah. So if you were thinking about, a future trial, is this something that you're, open to exploring? You're looking at, if the right trial came along, you'd be willing to, consider, enrolling or trying to enroll. And if so, what would make you now more or less interested in a trial?
I'm very open to doing any trial.
Okay.
And I have been cleared by my heart transplant group. And I am very interested in doing gene therapy. And to me, this is going to change the world. We all have to participate. And unless we participate, we're not going to find help for one another.
Yeah.
One of the things that I noticed is that when I first was diagnosed with Fabry disease, I would go into my doctors. Of course, I was a carrier. There was nothing wrong with me, blah, blah, blah. So then all of a sudden, I was like, you know what? I'm going to have to do this on my own. So I got on with Dr. Google. I found every organization that I can join. I've participated as much as I can in everything. I've done lots and lots of stuff because I think that that's the only way that we're going to have a change.
Right.
I happen to have a 30-year-old brother who died from a sudden death from the same thing. We don't know whether he had Fabry disease, but my mom was the carrier. So I'm sure I have other relatives that have Fabry, but they will not get tested. So we all have to join together and get this done.
Thank you so much, Karen. Catherine, I saw you nodding along there at points. You may want to add on to some things that were said, but I do want to also get your own views on what those most important factors that you would consider or did consider in the past for choosing to participate in a trial.
Hey, my name is Catherine Graves, and I'm from Florence, Alabama. I am a patient as well as a caregiver, and I have been in a clinical trial for the past 2 to 3 years. And I actually watched my dad go through clinical trials from the time he was diagnosed until when he passed away. But I'm an advocate for our disease, and I feel like that by participating in these clinical trials, that we're advocating and we're trying to, get something better for our community. I do feel like one of the important factors for me is doctors' recommendations. My doctor knows what's best for me. I feel like, he cares for me and he knows my disease. So, I definitely look to see what he has to say. Another factor for me is possible side effects.
Okay.
I have really bad infusion reactions to Fabrazyme. So that's one of the major things that, what could the possible side effects be for this drug that I am going to take?
Yeah. So maybe if I can ask about the kind of those two factors you just mentioned. In your case, is your doctor the same doctor that's running these any of these trials, or is it someone that's not running trials and is referring you to another doctor that is doing the trial?
My Fabry doctor runs the trials.
Okay. So your doctor is informed. They know what's involved with these trials because they're actually an investigator. They're helping run them. So for you, that their perspective on whether it's a good fit is really important to you.
Yes.
Yeah. And then on the side effects side of things, I assume there's probably some amount maybe of side effects that you would be willing to tolerate versus not. Are there, would you be willing to, experience, maybe, less severe but more common things like, headache. I know you already have a lot of, in Fabry, people experience a lot of GI issues, but maybe some added nausea, things like that. Maybe, there's different degrees of injection site reactions. Is that type of stuff a deal breaker for you? Is there some amount of side effects that, you'd be willing to experience, in order to have the potential benefits of a new drug? Kind of how do you factor that in? And, maybe related is, does that mean you would probably wait for later stage trials where there's more information about the safety profile of a drug versus maybe earlier on where we're still learning and focusing on understanding the safety profile?
I don't think that the side effects would be a deal breaker.
Okay.
I mean, when I had the reactions, my throat closed. So, nothing I don't feel can be any worse than that. So, if it's a few added headaches, I take medication daily for migraines.
Right.
If it's a little bit more GI discomfort, if ultimately it's going to better my life or my children's lives, then I definitely would be okay with participating.
Great, thank you so much. I see we have a caller. We have Jennifer from Iowa who would like to share some of her experiences with clinical trials. So I'd like to welcome Jennifer to the program and ask Jennifer, are you with us?
I am. Can you hear me all right?
I can. Welcome.
Thank you. Thank you for taking my call. My experience with participating in a trial is originally I was not interested in being treated for Fabry's just because I didn't think I was severe enough.
Mm-hmm.
But I would have to say that after the insistence of my primary provider, or Fabry's provider, being in the trial has given me a lot more insight as far as how bad the disease has progressed that I would not have ordinarily had that opportunity to know.
I see. So for you, it was really valuable to have that more careful monitoring of your status and kind of over time paying attention to that and telling you and updating you on that.
Yes, absolutely. Because ordinarily I would not have that kind of information.
Right. And has that helped you make decisions about what treatments to get on, or to whether or not to stay on current treatments that you might have already been on?
Oh, yes, absolutely. So originally I tried to get into a trial and was rejected or didn't qualify.
Mm-hmm.
So that led me to pursue on my own to have a kidney biopsy. And
okay.
As a result of that biopsy, it showed that I had a whole lot more GL3 bodies in my kidney that I even, you would never guess.
Sure.
With my symptoms that I have, because I don't have very many symptoms at all.
Okay. Great. Well, it's glad to hear about some of those kind of added benefits of participating in a trial, and that's something that kind of informs your decisions to participate in trials and might help inform others as well. I do want to broaden the discussion a little bit. We have one more polling question as part of this shorter discussion on clinical trials. So if you want to pull out your phones, go to that tab in your web browser, go to www.pollev.com/Fabry. Here we would like to know whether you'd be interested in a trial for a drug that's designed to do one of the following, even if it did not slow or stop the overall disease progression. And here you can select all that apply. Would you be interested in a trial that might help your benefit your kidney alone? B, a trial that might be for a drug that was intended to benefit your heart alone? Or C, a trial for a drug that's intended to reduce your symptoms, for example, pain or GI involvement or fatigue alone, but not, again, in any of these cases, is not targeted to slow or stop the overall disease progression. And again, you can select all that apply, and if none apply, you can select D. So we'll give you a few more moments here to get your responses in. We are eager to hear and see, which of these you would be interested in, why you've, selected one or more of these, or why, none of these would be appealing to you. As it stands, it looks like the top kind of area of interest from our audience today is a trial that would help benefit the heart alone, even if it didn't help slow or stop overall disease progression. We do see a fair amount of people selecting both reducing symptoms alone as well as benefiting the kidney alone as well. But we do have individuals that are saying that they would not be interested in any of these options for a clinical trial. So I'd like to come back to our Zoom panel here, thinking about this and some of the options, and would like to get your reactions to this question, because I know maybe this is a little different than some of the past trials that are, maybe were more intended to be trying to treat the underlying disease and slow or stop it. But these are some of the key things we heard this morning, areas where there are significant unmet needs. So maybe Sabina, I'd like to start with you again. And I don't know, one thing that I wanted just in general to hear from you about is maybe how your thinking on these things differs for yourself versus for your child, in thinking about whether or not you'd be interested in one of these types of clinical trials.
Well, when I took the poll, I actually, took the easy way out. I chose all three top ones because obviously we want to participate in these trials just to improve the lives of every Fabry patient if possible. And even within my own family, it's kind of difficult to answer that question because within my own family, all our symptoms are varied considerably. Some members are impacted, with their kidney function is impacted greatly. Others are their heart. Right. And others, their cerebral vascular issues. We all seem to fall under the umbrella of, all these other issues, GI issues, cold and heat intolerance. So it's a really difficult question to answer if you're trying to zone in on one. For my family in particular, probably the kidney function is one of the highest for my other family members. Now, for me, I would say me and one other family member, the heart. I think going back to the other symptoms, I would love for my GI symptoms to go away. I would love for to be able to handle heat and cold intolerance, but I don't feel like I may lose my life over that.
Right.
I think that those would make my life better, which is important because we do want to improve the daily lives of the families impacted by Fabry, but the kidney and the heart really can lead to the morbidity. So. Right.
But so it sounds like even if you could just address one of those things, you don't need something that addresses all. That you'd be interested in something that could help on any one front.
Correct. I think that they all have a lot of potential, and I think that the potential for participation is there.
Great, thank you, Sabina. Karen, let's go in the same order as before. What was your reaction to that polling question? What did you answer? And why did you pick what you picked?
So I think I would pick neuropathy. That would be like reduce the symptoms, because that's something that I continue to, suffer with every single day. And it doesn't seem that there's anybody out there that can help us. And the reason why I would pick just one item, because it's not realistic that one size fits all. We have to have 5 to 10 different doctors that specialize so only one item for me. Great.
Well, that's helpful to hear, Karen. And for you in participating in a trial that would be for a drug designed to help with your neuropathy, what would maybe be what you would hope to get from that, in terms of an outcome? What might represent some kind of meaningful improvement for you in your life?
Well, I would like to either be treated somehow without, I've been on the same drug now for 6 years, and the drugs are really, really tough on you.
Yeah.
And if you get the wrong prescribed drugs, like they just switched me maybe about 3 or 4 weeks ago, and I just was I had rashes all over my body. So it's really hard to treat neuropathy.
Yeah.
So I would hope that there would be something out there that would dull my pain, because that's something that hasn't gone away.
Sure. Thank you. And Catherine, to round out our Zoom panel here, same question, looking at, maybe addressing one of these, major buckets of Fabry health effects. Are those things, are those the types of trials you might be interested in? What are your thoughts?
I would say for my family, my dad had severe heart involvement and my uncle has severe kidney involvement. At this point in my life, my kidneys are more involved than my heart. So if I had to choose one of those, I would say probably geared more towards kidney. But I really would want a study that is for the entire progression of Fabry, and not just geared towards one or the other, or just symptoms, or
Sure. I guess thinking about that, something that would be addressing, the overall condition, would something that, maybe slows, the worsening or keeps you where you at currently, but maybe doesn't necessarily improve or reverse the condition. Is that something that would be of interest to you?
Yes, definitely. I have a 13-year-old son. He started infusions when he was 5. So anything that prevents him from losing kidney function and having to be on a kidney transplant list like my uncle, or dying of a stroke at 62 like my dad. I mean, anything that can keep him where he is and keep that disease from progressing in his major organs.
Yeah. Well, thank all three of you for all of your contributions during this discussion. I do see that we have some written comments that have been coming in. David, I know you've been keeping a track of that. So what are we hearing on the topic of clinical trials?
Right. So Amy from Louisiana writes that she would be very interested in entering trials, especially for pediatric patients, and especially when there are no other options and when the patients have developed antibodies to the only available treatment. And that's referring to antibodies against, the ERT.
Right.
And when the patient is clinically worsening. And Kim from New Jersey writes, as a patient, I would be most interested in a clinical trial option that my doctor believes has potential better results for me than my current treatment. Slowing or stopping organ involvement, including brain, would be important factors. As a caregiver to a child, I would look into all of this and whether it excludes them from future trials as well. So this points, I think, to the complexity of making a decision about a clinical trial.
Sure, sure. And for the first time, I think we heard there from Kim, this idea of, whether trying one thing is going to preclude you from maybe trying others as an important factor. I want to thank everyone for their contributions to this topic of clinical trials. It really is part of this larger discussion that we're now going to have around the current challenges to treating Fabry, by understanding what is currently available to you. We do want to know how well it's working, but also some of the limitations. So if we can pull up our discussion questions for this third session of the day. During this session, we want to hear from you. We want to know, what are you currently doing to help treat your condition and its symptoms? And when we talk about treatments here, we mean it in a really broad sense. We, of course, do mean, the approved treatments for Fabry, those disease-modifying ERT and chaperone therapies. We, are also referring to, the treatments that you use to try to help with the direct symptoms of the disease. But in addition to that, as well as, of course, medical procedures and surgeries, and we've even heard about transplants today, that is kind of on the table as well. But we want to cast a broader net than that. We want to also include maybe more holistic approaches, things outside of your routine medical care that you try or employ to try to make help with the symptoms or make living life with Fabry a little easier. Anything from diet and exercise, even just lifestyle modifications you've made to kind of, again, make coping with symptoms a little bit easier. So when we use the short-term treat or treatment, that's what we're trying to capture all of those different things. So, in addition to knowing what you're currently using, we want to know how well those treatments are helping treat the most significant symptoms of your disease. And in addition to your assessment of how well they're working, we do want to know what are the most significant downsides to your current treatments and how do those downsides affect your daily life. And finally, at the end of our session today, we'll shift the discussion to talking about future treatments. And assuming that there's no complete cure for your Fabry, what specific things would you be looking for in an ideal treatment for your condition? So to get us started on these topics, we have a panel of your peers, individuals with Fabry, and caregivers who are going to be speaking to these topics. We have Paul, Jennifer, Lisa, Christopher, and Tabitha. Paul, take it away.
Hello, my name is Paul and I am 46 years old. I live in New Hampshire with my wife and our dog, where I work as a program analyst for the Department of Defense. After battling typical symptoms of Fabry disease for years, and after numerous misdiagnoses, I had a kidney biopsy and genetic testing that confirmed Fabry disease in 2007 at the age of 31. Less than 2 months after diagnosis, I started enzyme replacement therapy, or ERT, on a medication known as Fabrazyme at Johns Hopkins Hospital. The treatments were every 2 weeks and began at an infusion rate that had me in center for over 8 hours, not counting the 30 to 45 minute commute each way. On the fourth treatment, almost at the end of the infusion, I had an adverse event where my blood pressure began to rise, my throat began to swell, and my body experienced rigors. Over the next year, we relocated from Maryland to New England. In the new infusion clinic, the infusions still lasted 6 hours with the same adverse events occurring, but even sooner after the infusion started. I would get rigors and the nurse would put a heated blanket on me. This didn't help the situation because I wasn't cold and my heat intolerance made having a heated blanket on me even more uncomfortable. Eventually, after 9 months of experiencing infusion reactions, working with my prescribing physician, we came up with a correct pre-medication regimen of Tylenol, Claritin, and prednisone. As a result, the adverse reactions stopped. The infusion rate slowly increased, and my time in the infusion center decreased. Less time in the center meant more time either working or with family and friends. I now also had the flexibility to schedule infusions at different times of my infusion day because less time was needed to be hooked up to an infusion pump. ERT wasn't stopping the worsening damage to my kidneys, and I began searching for an organ donor. In 2009, a college classmate and friend donated one of her kidneys to me, and my life was instantly changed for the better. I was very fortunate to have a preemptive transplant and not have to be on dialysis. I continued on Fabrazyme after the transplant, but never noticed a marked improvement in my non-renal symptoms. GI issues and pain associated with heat intolerance continued. Shortly after my kidney transplant, problems with the production of Fabrazyme reduced its availability to patients for approximately 3 years. For me, this meant longer periods between treatments, and at points I received only one infusion instead of the usual 2 per month. I also noticed an increase in the severity of my symptoms, specifically GI issues such as diarrhea. The diarrhea was occurring more often than when I was receiving my infusions at the prescribed interval. When I was diagnosed in 2007, I underwent genetic testing that showed a mutation in my alpha-gal gene. In 2018, this genetic information was used to justify prescribing Galafold, which is an oral therapy. I took 1 pill every other day and took this treatment until May of this year. While taking Galafold, I had more energy and my gastrointestinal symptoms improved. However, although I have a mutation that helps Galafold to be effective, it appears that the enzyme activity in my body was still not increased sufficiently. My lyso-Gl3 level was still high. In February of this year, I suffered a stroke. As a result, I underwent a procedure to insert a heart monitor to help identify potential causes of the stroke, such as atrial fibrillation or AFib. Between the stroke and my rise in lyso-Gl3 level while on Galafold, my physician urged me to transition back to Fabrazyme. Without an agreed-upon set of parameters to monitor in order to determine if the Galafold is effective, she was skeptical that it was working for me. I don't feel Fabrazyme or Galafold have improved my Fabry symptoms except for sweating. I do sweat more now, but not what I would consider equivalent to one of my healthy family members or friends. Fortunately, I'm able to work remotely while receiving ERT because immediately after, I feel run down and don't have energy to do much of anything. I have noticed while being back on Fabrazyme that my overall energy level has decreased as well compared to when I was on Galafold. Many days, I feel as though I need a nap in mid-afternoon, even after a good night's rest. Currently, in addition to Fabrazyme, I take carbamazepine for pain associated with intolerance to heat, ginger pills to assist with my GI issues, and Eliquis for reducing blood clots from AFib, Lipitor and baby aspirin for heart health and prevention of additional strokes. As far as new treatments for Fabry disease, I would like an oral treatment that is not specific to the genetic mutation of a patient. Being able to travel while not missing treatments is very important to me. Also, a treatment that can cross the blood-brain barrier and prevent strokes and TIAs is very, very important to me as well. For infusions, we need more medications that do not create adverse events. We need medications that are available to the entire community and that address all, or at least most of our symptoms. Thank you.
My name is Jennifer O'Brien. I am 56 years old and live in Winterset, Iowa with my husband and my 18-year-old daughter. I am a same-day surgery nurse at our local county hospital and I work part-time. My sister and I have a unique perspective on Fabry's disease as children. It's been a constant threat in our lives that has ebbed in and out of our consciousness. Our father was diagnosed with Fabry's around 1970. The whole extended family was tested, and our grandmother, aunt, our cousin, her son, and my sister and I were tested positive for Fabry's. Our father died 6 months after receiving a cadaver kidney transplant in 1972. Debbie and I exhibited symptoms as Fabry's as prepubescence. We both had the neuropathy or pain in our hands and feet when overheated. Debbie had some hearing loss and spilled protein in her urine. As a child, I experienced the neuropathy that would only occur under extreme conditions, like at basketball camp at 95-degree heat with little air conditioning. In 1984, our male cousin, also diagnosed with Fabry's as a child, had committed suicide. The family was devastated. As young adults, we knew we were carriers, and the possibility of a male or female with Fabry's is 50%. We knew the inheritance pattern and the ramifications of having a male child with Fabry's. Debbie got married a few years later. She had 2 sons. With each pregnancy, she had chorionic villus sampling done, and each child was negative for Fabry's. By this time, she continued to spill protein in her urine, had neuropathy and fevers with overexertion, and now had hypertension with ventricular hypertrophy. Our first pregnancy was terminated after our CVS result was a male with Fabry's. In 2008, I had an eye exam that showed whorls in my cornea and was sent to an appointment with the nearest Fabry's expert. I had a series of detailed testing, and one of them showed shadows on my brain MRI. My physician's assistant encouraged me to start enzyme therapy, but I was hesitant. The cost and the effort to treat was extensive, and would it really benefit me? My sister was concerned about her health and decided to start enzyme replacement therapy with her protein spillage. I was started on a low dose of valsartan to protect my kidneys. I knew that even if I was asymptomatic, that the accumulation of the GL3 is irreversible and damaging, but questioned really how much I was affected. The phase 1 trial of Protalix offered extensive testing, including a kidney biopsy at their cost. My baseline organ damage did not appear significant, and so I was not accepted into trial and did not have the kidney biopsy done. My Fabry's provider helped me independently to get a kidney biopsy to help me decide whether I needed enzyme replacement therapy, and that biopsy showed that I had moderate amount of GL3 bodies in the kidney. I started on Fabrazyme and had been on treatment for the last 4.5 years. My blood pressure dips only in the first 15 to 30 minutes of the infusion. Otherwise, I can't tell a difference. I was on Fabrazyme for 2 years, and then in 2019, I was accepted into the phase 2 Protalix Fabrazyme blind study. My infusions are every 2 weeks, and initially they were done at the infusion center under close observation. But now they are conducted at my home by my infusion nurse. I feel really fortunate that I don't have to drive the 2.5 hours to my infusion center and can have them done in the privacy of my own home. However, there is the hassle of jockeying vacation and travel time around these infusions. Extending the drug's half-life to allow monthly infusions would be a significant improvement to my life. I continue on treatment, and I live on the precipice, hoping not to move into more severe kidney disease and multisystem decline. Thank you.
My name is Lisa. I live in East Stroudsburg, Pennsylvania with my retired husband, adult son, and daughter. I was diagnosed with Fabry disease in April of 2015 at the age of 49 after experiencing severe debilitating pain in my legs. It felt like severe cramping along with weakness. It prevented me from holding myself up, which resulted in me needing a walker. After having my children tested first and confirming that they did not have Fabry, I started treatment in June of 2015. Prior to diagnosis, I worked as in the customer service and management field for over 30 years. Now disabled due to pains in my legs, hands, and feet, I spend my time learning and advocating about this rare disease. When I feel up to it, I enjoy being outdoors, gardening, traveling, listening to music, cooking, and helping others. Fabry disease runs on my mother's side of the family. Along with her, I have 2 living siblings, nieces, and cousins with Fabry. My oldest brother passed away before being diagnosed, but now that I know the symptoms, I know he had it. And I lost my youngest brother last year due to kidney failure. I've been on Fabrazyme infusion for 7 years, every 2 weeks. The treatment started slowly as an 8-hour infusion at Mount Sinai Hospital in New York City, and gradually increased the infusion rate until the whole procedure is down to 2.5 hours infusions at home. The 8-hour infusion consumed my entire day. The ambulance service would pick me up at 7 a.m. I would arrive at the hospital at 9 a.m. and I would finish around 6 p.m. Once picked up and arrived home, I would just eat something and go to bed. I felt extremely tired after the infusions due to the Benadryl and Tylenol, but these pre-infusion medications are necessary to reduce the possibility of allergic reactions. Even though I spent 8 hours at the hospital, I was comfortable in a bed. I would spend that time reading, resting, and watching TV. Another important change in my treatment now is the infusions are done at home. Home infusions are a lot more convenient than going to an infusion center. The infusions help ease some of the pains in my hands and feet a little bit. I usually feel a difference in how I feel within 24 hours after the infusion, and it helps for about 10 to 12 days. But the infusions haven't made too much difference with the brain fog, as that continues to be an issue. I'm happy to have a treatment, but I feel like my life is centered around Fabry and infusions. Anytime I want to plan something or schedule anything, I would have to be mindful to make sure that it's not on a supply delivery day or an infusion day. And infusion days are subject to change, which creates even more uncertainty. It's difficult living with a disease that's unpredictable. I never know how I'm going to feel each day. It's also hard because I do not have a choice of treatment. I would like to have a treatment that doesn't require accessing a vein for each infusion. After many years of infusing, the veins start to collapse and become scarred. This makes it harder to access them. I wouldn't want to go through getting a venous access port because it might create more issues to deal with, like infection along with pain. A lot of supplies are also required to do home infusions. This means a lot of storage space is necessary. There are also concerns about issues with the infusion nurse. I have been through 4 infusion nurses in the last 4 years due to various reasons. Each time a new nurse is assigned, I contact my Genzyme rep to do an assessment with the nurse to make sure that they know how to mix and administer the Fabrazyme properly. Most of the nurses I've had have never had or heard of Fabrazyme before, and having someone unsure on how to mix it properly is not something I want to deal with when I'm already dealing with my symptoms. Also, considering how expensive the Fabrazyme is and how badly I need it at infusion time, I need a nurse who knows how to mix the medicine quickly and properly with no waste. I would like to have better options for treatment, something that doesn't require being pre-medicated, a treatment that's going to help eliminate more pain and reach the brain, a treatment that doesn't require so many supplies. I would like to have something like a daily pill or something monthly. We need a treatment that will be good for all mutations, a treatment that will give us back some type of freedom and normalcy to our lives.
Hello, my name is Chris Murphy. I'm 51 years old, and I live in Fairfield, Connecticut with my wife, Margaret, and my 15-year-old daughter, Lucy. During my work career, I spent time as a salesperson and sales leader in the information technology field. In 1986, at age 15, I went to my doctor for a pre-summer camp physical and blood test. My results showed protein in my urine. Within a year of that finding, at age 16, I was diagnosed with Fabry disease. Since that time, I've been through 3 kidney transplants. My first in 1992 lasted for 4 years, and the second in 2000 lasted for 20 years. Both of these ultimately failed. My most recent transplant occurred in September 2021. Beyond this, I've endured 3 periods of dialysis, ranging in duration from 6 months to 4 years, triple bypass heart surgery, and a host of other procedures and complications. Along with my kidney and heart issues, I've experienced enduring brain fog, neuropathy, fatigue, and GI issues that have, to lesser or greater degrees, impacted my life. In the summer of 2002, I began enzyme replacement therapy with the experimental medication Repligal. This involved visits every other week to Manhattan for a roughly 1.5 hour long infusion. I underwent this treatment for 10 years, making the 2-hour plus round trip commute, while holding down a full-time job and trying to fulfill my responsibilities as a husband and a father. In 2012, I switched my treatment to Fabrazyme when Shire removed its application with the FDA. This was a challenging change as it involved a much lengthier infusion process, which was upwards of 4 hours as compared to the 1.5 hours on Repligal. All in, I was looking at a 6-hour process every other week. Combined, these therapies over 2 decades amounted to approximately 2,400 hours of treatment, which equals 300 8-hour workdays. That's almost a year and doesn't include time spent at doctor visits, varied and numerous surgeries, dialysis treatment, or the time lost due to the everyday life of a Fabry patient. The larger impact of all this, and maybe what's the most important to me, was the time I lost with my family and my friends. Currently, I'm seeking to switch my treatment to Galafold oral therapy. This change would potentially vastly improve my work-life balance, as it would eliminate the need to travel to an infusion center and endure a multi-hour treatment. Of particular note, this medicine has the potential to cross the blood-brain barrier, hopefully allowing for treatment of and relief from the brain fog that is the result of Fabry disease. It is also potentially effective in reducing heart wall thickness, which is attractive to me due to my Fabry and family-related cardiac issues. On top of the two decades plus of ERT and the challenges this entailed, I have lived with the side effects of medications that help support my kidney health, treat my heart disease, and manage related conditions. These include immunosuppressants such as tacrolimus, Myfortic, Imuran, and cyclosporin, steroids such as prednisone, blood pressure pills like carvedilol, losartan, and amlodipine, and a host of other drugs. All of these and other medications have been necessary and life-sustaining for me, but they also have had an impact on my body that includes arthritis, enduring foot pain, blood sugar challenges, gastrointestinal issues, and fatigue, just to name a few. The fatigue from Fabry's, as well as from some of the medications I've taken, has proven to be an ongoing struggle. Imagine waking up every day tired and staying tired throughout that day. Or think about taking prednisone and the related side effects to a person's bones and blood sugar. It's ironic that prednisone, which helps take care of my kidney, can also lead to increased blood sugar levels, the result of which can bring about damage to that same organ. Personally, an ideal treatment would more effectively address the symptoms I deal with every day from Fabry disease. Beyond the heart and kidney challenges I face, I want to worry less about my GI issues during a car trip or when visiting friends. I want to have increased confidence that my brain fog has been reduced to a level which allows me to be more confident in my memory recall. I want the chance to spend more quality time with loved ones and fully enjoy the life that my donated kidney has brought me. Maybe most importantly, I want my family and friends, those who have done so much for me over the past 35 years, to worry a little bit less about me and to let me take care of them for a change. I want a treatment that will help those in my family afflicted with this disease live fuller lives. I want a treatment that will let me see my daughter, who also has Fabry disease, graduate from college, begin a career, and maybe get married. Hoping against hope, I want to hold her child in my lap. In part, ERT has provided me with the opportunity to not only survive, but to live a fulfilling life. While taking nothing away from the treatments I've received, my hope is that more effective medicines will be developed and that they will offer all Fabry patients, as much as possible, a future free from pain, sickness, and health challenges. Thank you.
Hi, my name is Tabitha. I'm 37 years old with 4 children. We live in northern Michigan, and all 5 of us have been diagnosed with Fabry disease. So I'm a patient as well as a caregiver. My 15 and 16-year-old daughters and myself have taken Fabrazyme for about 5 years. Because we have a genetic deletion, Fabrazyme is the only current available option for us. The treatment is an infusion every 2 weeks. We began our treatment at a short stay unit in a hospital about 2 hours away. Once we arrived, the nurses could order our medication and we were prepped for infusion. The entire process from start to finish usually took about 5 hours. Combine that with a 4-hour round-trip drive, and treatment day was very exhausting. Recently, we started home infusions, which has their own difficulties. Every other Thursday, the 3 of us infuse at home. Being responsible for ordering all the supplies for 3 people as well as medications can be stressful. On 2 different occasions, Fabrazyme has not made it in time for our infusion day. On one occasion, the meds went to Australia. By the time the med reached our home, they had to be discarded because they hadn't been kept cold. Sometimes UPS would come back to our house 2 and 3 times a day because they've missed boxes in our delivery. It's more work compared to the short stay unit. But on the other hand, staying home, I don't have to stay awake for the drive home after a 5-hour infusion. It feels like trying to weigh the lesser of 2 evils, balancing a lot of unknowns and hoping I've made the right decision. For instance, during a home infusion, anything can happen. And if our home nurse isn't qualified or able to resolve the issue, then we're forced to go to the local emergency room. As it stands, I've had 3 ports replaced in 4.5 years, and my daughters have had their ports repaired or replaced twice each. Also, sometimes the venous access ports cannot be accessed for whatever reason. Then we can't get our treatment. Whereas if that happened at a facility, other nurses or professionals might be able to help resolve the issue. Over the years, some significant changes have occurred regarding my treatment-related symptoms. For the first 2 years, about an hour into treatment, I would experience gut-wrenching cramps followed by diarrhea. It would last the entirety of the treatment and into the evening once I was home. Thankfully, this symptom has since stopped. One of the most significant symptoms I struggle with is fatigue. In the 1 to 2 days leading up to treatment, my body feels like it has been unplugged from its energy source. To say I am tired does not come close to the level of exhaustion I feel. Everything is a struggle, from getting my kids dinner to getting up off the couch to use the bathroom. Usually within a few hours of treatment, I notice a significant change in my energy level. During treatment, I'm able to catch up on tasks around the house that have been left unattended due to my inability to function for the 2 days prior to treatment. Our pumps are in fanny packs that we wear around the house, which allows us to move freely within our home. It's literally like someone has plugged me back into my energy source. The other symptom of Fabry that affects me a lot is the burning sensation, mostly in my hands, but also in my feet. In the days leading up to treatment, my hands become beet red with white splotches, very hot to the touch, swollen, and it's painful to bend my fingers at the joints, and it's even hard to grip a pen or a cup. I often have to take off my rings on these days because the swelling is so severe that the rings leave indentations on my fingers. Although the burning in my hands never fully subsides, it's easier to deal with after treatment. I notice a significant decrease in pain and swelling, as well as increased dexterity. On a scale of 1 to 10, with 10 being the worst, before treatment, I would rate the pain at an 8. Within a few hours of treatment, it would drop to a 3 or a 4. The biggest burden I have with treatment is convenience. As a patient, but even more so as a mother, I am beyond grateful for the treatment option my family has. However, the reality of spending a full day every other week for the rest of our lives hooked up to an IV is disheartening and overwhelming. So much time and effort is put into making sure everything runs smoothly for home infusion. On top of having a home nurse in our home for nearly 5 to 6 hours every other week, having other children in the home not on treatment is a huge burden. While my 2 non-treated children understand that we have Fabry and we are well aware of treatment days, it is difficult for them because our lives are limited. No walks to the park, no swimming in the pool because I'm not there to watch them, no friends over, constant reminders to watch our tubes and poles. I would consider a future treatment if it were as effective as Fabrazyme, but also if it were more convenient. Perhaps a single dose daily pill, or perhaps an injection every so often rather than an infusion. The most important things to me are, will the treatment slow the progression of the disease? Is it safe? While life would be easier with a simpler treatment option, I'm unwilling to sacrifice effectiveness.
Thank you, Tabitha, and to all of our panelists who shared your journeys and experiences with different treatments and the decision-making that went into deciding whether to use and change your treatment approaches over time, as well as your thoughts and insights on what you're looking for from future treatments. This brings us to our third opportunity of the day to hear from all of you in our live audience, those living with Fabry, and your loved ones and caregivers, to hear their views and perspectives on current and future treatment approaches as well. Like in our earlier sessions, we're going to get a sense of our experiences in the live audience and get all of you thinking about your experiences through a couple of polling questions. So go ahead, pull out your phone, open up that browser, go to that tab in your web browser on your computer if you're following along there. Go to www.pollev.com/Fabry. Again, please keep this open throughout the afternoon session, this final session of the day, and we will be asking polling questions periodically. So for all of our patients and caregivers, we'd like for you to select the medications that you or your loved one either currently use or have used for your Fabry disease, and you can select all that apply. The options are A, enzyme replacement or treatment or ERT, B, oral chaperone therapy, C, ACE, ARB, beta blocker, diuretics or other blood pressure drugs, D, drugs for high cholesterol, E, drugs for high potassium or high phosphate, F, blood thinners or anticoagulants to prevent blood clots, G, gabapentin or other anti-seizure drugs for pain, neuropathic pain, H, hearing aids or drugs for hearing issues, I, drugs to treat the gastrointestinal issues directly, J, kidney dialysis or transplant, K, heart transplant, L, drugs to treat abnormal heart rhythm, M, antidepressants and or anti-anxiety drugs, N, anti-inflammatories or immunosuppressants, O, any other medication as well as non-prescription remedies that you may use to try to treat your Fabry disease and its symptoms, or P, if you have not taken any medication or used any remedy for your Fabry disease. So I know there's a lot, we've already heard a bit today about the range of different things people are taking. Here we really want to explore that more fully. So we're asking that you please select all that apply. Again, we're seeing percentages of the total responses, so not the percentages of people picking any individual response. As it stands, it looks like the most experience with medication in our audience today is with ERT. After that, we see experience with drugs for high cholesterol, ACE, ARBs, beta blockers, diuretics, and other drugs for blood pressure, blood thinners to prevent blood clots, gabapentin and other anti-seizure drugs for pain, other things not that we haven't listed, so we certainly also want to include in our discussion an understanding of what you use beyond maybe some of these major categories of medications. But everything here we do have people represented that have experience with them, including both some of the most invasive medical procedures of kidney dialysis or transplant and heart transplant. So for those of you with those experiences, we want to hear from you as well. And no one is reporting that they've not taken any medication or any remedy for their Fabry. If we go to our second polling question, so here we want you to think about all of those different things that you have and currently use or your loved one uses, and we want to know how well have your Fabry-specific treatments reduced the most significant symptoms of your disease. So the options are A, not at all, B, minimally well, C, moderately well, D, extremely well, or E, if you do not currently take any treatments. So how well are your most significant symptoms currently managed or reduced? So we know this is a very subjective question, and the key thing is we want you thinking about why you've selected which response option that you've picked. If you are in that category that's selecting minimally well, which currently has the most responses, why did you report it as minimally versus moderately? What more, in terms of reducing those symptoms is needed on top of what you're already benefiting from current treatments? So we'll give you a few more moments to think about this, get in a response, and most importantly, again, we want you to think about this, and we hope that you'll call in and write in to help us understand, your experiences with current treatments. So it's a little bit of toggling back and forth, but it seems that minimally well and moderately well, the majority of people are fitting into one of those two categories. We do see a little over 10% of people reporting that their current treatments are reducing their most significant symptoms extremely well, and then a little under 10% reporting that they're not helping at all. No one is reporting that they don't currently take any treatments. So now that you've had a little bit of time to think about these issues, I want to encourage you to call in to share your treatment experiences. You can dial in at 1-703-844-3231. Again, that's 1-703-844-3231. We'd love to hear your voice. If you call in, we'll get you in the queue and bring you into our conversation on the live program today. We want to hear as many voices as possible. You also have the option, use that little comment box that's underneath your live stream, and you'll be able to write in with your thoughts and comments, and we'll be reading and sharing those throughout the program. But to start us off on this discussion, I'd like to welcome our Zoom panel, another panel of your peers who are here to help contribute throughout this afternoon session. And so, Linda, maybe we can start with you. Maybe you want to start a discussion on the things that have been most useful or most helpful. Thinking, at that long list of different treatment approaches, what sticks out as being the most helpful thing from your perspective?
Good afternoon. My name is Linda. I live in Florida, and I'm a Fabry patient. I take Fabrazyme, and I have to take the opportunity to thank the FDA for that wonderful medicine. It has changed my life. I feel so much better. I did not start it until I was 50, so I had many, many years of a lot of pain and suffering. And I love my Fabrazyme. I'm so grateful and thankful for it. Let's see, another question.
Well, just thinking about that, since it's been so helpful, can you maybe tell us, what are the ways that it's most helped you in your life? What has that looked like?
Yes. I suffered from much pain. I do have the benefit of knowing from 10 years old that I had Fabry because my dad was still diagnosed then, so I knew I had it. So I could protect my body for all those years from a lot of harsh things that could have hurt my body. So it has improved the pain level. I grew up vomiting, diarrhea, terrible stomach pain. And
are these things now that you still experience, just to a lesser degree? Has it helped eliminate some of these things completely? Just maybe a little bit of background on that would be helpful.
Now, I'm not healed.
Yep.
This has not cured the Fabry disease, but it is much, much less than it was before. I feel like I live a normal life. I'm very happy in my life. I get to do many, many, many things. I've had many opportunities in my life, and I feel sure that I wouldn't have had that without my Fabrazyme.
Great. Well, thank you so much, Linda. That's been very, very, very helpful to hear. I'd like to bring Cheryl into this conversation. Still at this point, we kind of want to maybe focus here first on things that have been most useful or most helpful. It could be anything from any of the different approaches to treatment that we're talking about. What sticks out for you, Cheryl?
Hi, I'm Cheryl. I'm from Rochester, New York, and I am a Fabry patient. I was diagnosed at age 16. I've been fortunate to have all of the ERTs and one of the chaperones. I really think right now the chaperone drug is helping immensely for me because I don't have that up and down, that day 10, 12 where, all right, people would say at work, oh, you're due for infusion, aren't you? And it's like, how do you know? And they go, we can tell by your eyes, you're exhausted. And I was like, oh my gosh, it hit me weird. But then when I got on chaperone, there's no ups and downs. There's not that wave. I still have the fatigue is severe at times, but I have noticed with the chaperone drug, I had many TIAs. I was going every 2 to 3 months with Fabrazyme, being in the hospital and being, all that good stuff. And I've had seldom TIAs now, like it's been 3 years. Okay. And just the pain crises alone, I can manage them so much better. And it helps also that I am retired. Yeah. So I can go to sleep when I need to go to sleep.
I see. So when you're talking about, it's great to hear about the TIAs, but you're talking about kind of more of like the roller coaster up and down. What symptoms were kind of, fluctuating like that now kind of are more, maybe, you can tell us are they fully gone? Are they just muted? But at least are less up and down.
The fatigue was just extreme. Like I said, days 10 through 14, and even the day after infusion because of the Benadryl. I would just
Oh, okay.
very fatigued. Now I'm still tired. It's like you wake up tired, like I'm sure a lot of the panel members have said,
Right.
but it's easier to control now. It really is.
Oh, well, that's
With the
great.
Galafold.
Yeah, and other than maybe your colleagues noticing, does that kind of, baseline reduction and being tired, what has that meant for you in terms of daily life?
It's meant so much. I feel like between the infusions and like your other panel members were saying, being you're having to take a half a day off of work and just feeling crappy. I feel now that the only way I know that I have Fabry disease is if, that I'm taking a pill every other evening. Otherwise, I don't have to remember it. And it's just, the fatigue is so much less. It really is.
Yeah, well, thank you so much for sharing, Cheryl. Juby, I'd like to bring you into this conversation as well. Has there been anything that's been most helpful for you?
I'm from the New York tri-state area, and I am a patient and a provider and a payer. I've been a nurse for almost 30 years, 35 case manager. For the insurance side, with a healthcare finance background, so I design a lot of programs. And the first time I ever saw Fabry was looking at a high-cost medication list for the insurance for the year, and Fabry was top second. Within my family, there are double-digit high-level number of people that has been diagnosed in the last 7 or 8 years.
Mm-hmm.
And what has helped me is taking charge and being very involved and being active in what is going on with me, and proactively applying multitude of interventions. Since I do have a background in trying to manage chronic conditions, I had to take charge of my health. I'm driving the seat now. Before I let others drive, and I didn't know I had Fabry's at that time. I did, and now that I do, I have taken charge, and it's been a journey. So I equate it to driving a car and you're hitting a hill and you try to press it a little harder on the acceleration. It turns out to be a mountain, and you're trying to climb that mountain, and it's very hard. Yeah. So I wanted to thank National Kidney Foundation and the Fabry Support and Information Group, Jack, for making this happen, and thank you.
Yeah, so Juby, maybe just so we can understand a little bit more, it's empowering to hear, about your taking charge and helping, helping getting you on the right path for treatments. What does your treatment regimen look like these days? Where did you end up landing?
So I incorporated I have a multidisciplinary team that works with me. Now some of them are college friends that I just call or say, you're part of this now. Versus, you make an appointment, go to a physician, yada, yada, or get a test done. I have the ability to tap without going through that process. So I do have a multidisciplinary team. I apply non-traditional method in addition to traditional, which includes integrative medicine, functional medicine, nutraceutical supplements under medical guidance, some regenerative medicine, anti-aging. It goes on. But I would like to say for the kidney disease,
yes,
the most impactful that I found, and it took a lot of research to figure this out, you can reduce the burden on your kidney if you allow other organ to excrete the waste that needs to be excreted. So your body's biggest organ is skin. So my skin is acting part of the kidney's job at this point. And for the fatigue, which is tremendous, I have anemia, I'm going through menopause, so hormonal changes. then the Fabry, there's the diabetes. It's horrific.
Yeah.
It's brutal. It's the word I could use. And I find that a Pilates machine, not just a Pilates on a mat, but a Pilates machine, because you cannot use a lot of cardio, you cannot run, you cannot do treadmill.
Okay.
A Pilates machine where you can lie down and do things is really helpful.
Yeah.
And then lifting weights is also very helpful.
Sure.
And then keeping on top of your labs is very important. So every 3 months, I get my labs done. It's been going on for over 10 years before my Fabry diagnosis, because I had some symptoms that seem to, now I understand is partially related to Fabry.
Yeah.
And I keep track of it. So I actually have my own electronic medical record system that I keep everything on.
Sure. Well, Judy, thank you. I mean, you covered a lot of different approaches here, and it's helpful to hear about so many of them. I do notice that we're getting some comments in. I want to check in to see if what we might be hearing on the topic of treatment successes.
James, Lynn from Florida writes, Fabry disease has affected my life for 60 years, from many family losses to having chronic pain. I've managed quite well with the help of Fabrazyme since 2004, and by educating myself with all the information that's put out there by companies such as those you're paying attention to now. It's important that you understand the life-changing possibilities. So I think that's a statement of hope.
Yes.
In terms of treatment.
Yeah, thank you, David. So I do want to broaden the discussion a little bit. We have been focusing on things that have been most helpful. But we know that even things that are helpful may have downsides that come with them. I know we've heard a little bit about that already today, but there also may be things that you're trying that maybe aren't as helpful, or you maybe haven't, for you at least, provided the benefit that you're looking for. So to explore that, we're going to start off with a polling question on this topic. So go ahead and get that polling webpage back out, pollev.com/Fabry. And here we want to know, what are the biggest drawbacks of your current treatments? And we're going to ask that you select up to 3 of the biggest drawbacks. The options here are that they're A, not very effective at treating the target symptom or health issue or issues. B, it only treats some but not all of the symptoms and health issues. C, the high cost or copay, or it's not covered by insurance. D, the limited availability or accessibility of it. E, the side effects of the product or procedure. F, the route of administration of the product. G, that it requires too much effort and or time commitment. H, some other drawback that's not listed here that to you is one of the biggest drawbacks of current treatments. Or you can select I if you do not currently take any treatments. So again, here we want to hear about what you view as the biggest drawbacks of current treatments. Based off of the wide range of things that you currently have available to you. So we'll give you a few moments to think about this, what represents the biggest drawbacks to you or your loved one. So results are still trickling in here. One thing that it looks like the fact that treatments may treat only some but not all of the symptoms is a top drawback, followed closely behind route of administration. We do see that the amount of time and effort needed for treatments is maybe number 3. And then followed behind that, we've got issues that they're not very effective at treating the target symptom or health issue. And maybe also that is the high cost copay or issues of insurance not covering it. But every single thing here is in somebody's top 3, so these are all important for us to understand and discuss, so that we hope that you will, share your voice and your perspective on this. We hope that you'll call in and share those perspectives. The phone number to call in is 1-703-844-3231. Again, you can call in and join the discussion on, currently we're talking about available treatments and your experiences with them at 1-703-844-3231. You can also write in with those comments under the live stream here. But I'd like to circle back now to our Zoom panel. And Mary Frances, we haven't had a chance to hear from you yet. So we still can talk about things that have been most helpful, where we've added to this discussion things that maybe represents the biggest drawbacks or downsides. What's a treatment experience you'd like to share with us?
Hi, I'm Mary Frances, and I live in St. Louis, Missouri, and I am a Fabry patient. I was diagnosed about 13 years ago, but I didn't start treatment until a year ago. I didn't experience severe problems until about a year ago. So I had gone into a clinical study, but the medication didn't work well for me. I would prefer a pill, but I'm now on Fabrazyme, and all I can say is thank you, thank you, thank you.
Yeah.
Because once I started the treatment, I had no idea how bad I actually felt. There's the plus side to it is that it has helped alleviate the pain in my hands and my feet.
Right.
I had a strange rash on my hands and my feet for 10 years, and it's gone. I mean, it's just amazing. The one downside is, though, I do agree with that at about 10, 11 days after the enzyme, I start to have the fatigue again. So what I've learned through this, and it's only been a year of really studying myself, is that I have to really pay close attention to what's going on with me.
Right.
I am actually a yoga instructor, and I teach at a university, which I'm not teaching at the university now because of the fatigue. And I'm only doing the yoga instructing like once a month because of the fatigue. But that actually has helped me be more still, more conscientious of what's going on with me.
Okay.
And I have 5 grown children and grandkids. And the other thing that I've had to do is really step back from being so involved in everything they do and stay closely connected to what's going on with me physically. If I get enough rest, I'm good to go. I can participate in a lot more things now because of the enzyme replacement therapy. And I just have to say it's been really great. I did have a mild stroke 5 months ago, and I do have some mild cognitive impairment, but I'm seeing a bunch of different cognitive therapy people and doing different things. So they're studying the white matter in my brain.
Okay.
And so hopefully they'll have more studies that will help influence the medications for that kind of symptom that's going on. I don't know that Fabrazyme affects that at all, but I do also have a heart condition, and Fabrazyme in the last year, nothing has changed. And my kidneys the numbers are better.
Okay.
I mean, it's just amazing to me. So I'm so grateful to Fabrazyme.
Yeah. Well, Mary, you covered a lot there, and I'm glad to hear so much has improved or stabilized for you. You were talking a little bit about the one downside is that, towards the end, of your treatment cycle or in between cycles, the fatigue comes back. I was wondering, because you also mentioned that it helped reduce some of the pain in your hand and feet. Does that come back as well towards the end of that cycle, or is it really just the fatigue?
Just barely. I get some kind of cramping in my left hand.
Okay.
And the other big issue for me is the GI issues. But I've discovered as I've corrected my diet, which when you feel that fatigued, you really don't want to worry about that. But as long as I maintain really conscious of what I'm eating and how I'm eating it, I feel so much better.
Okay.
But it's in combination with the ERT.
I see. Well, that's very helpful. Thank you so much, Mary. For our other 3 Zoom panelists, if you want to give me a little wave, I want to know if any of you, have a treatment downside now that we've kind of broadened to this topic that you'd like to share from, any treatment approach that you may have tried. Kind of thinking of that polling question, whether it's something that maybe hasn't helped as much, either, treat all of the symptoms or the target symptom, or maybe something that does have more of a direct downside. Is there anything that you'd like to contribute? Yeah, Cheryl.
Hi, I have noticed, I was on the Fabrazyme. I was one of the first women put on it in the early stages. And it was great for like the first couple of years. And then I just noticed a decline. And it worries me now, even with a chaperone, that I'm fearful that my body is just going to be all of a sudden realize that, okay, well, we're just going to go on the decline again because your system is used to this. So that in that response, it does worry me because I've seen the decline with the other enzyme therapies, and I'm very fearful that my body will decline again.
Sure.
Thank you.
No, that's helpful. Okay, well, I do want to check in with David to see if we're seeing anything in terms of comments for treatment downsides.
Right. Steve from California writes about something that we've heard several times today. The time involved and on a weekly basis for ERT is very difficult and interferes with life's plans. As well, it causes damage to the veins. A treatment that could be done one time per month would be extremely helpful in reducing the amount of medical appointments per month or per week.
Yeah. Well, thank you for that comment, Steve, and want to encourage people to continue to call in, write in, and share your experiences. We do want to broaden the discussion one more time here this afternoon. I know a lot of the different treatment experiences have come out throughout the course of all of today's meeting, but I do want to make sure we will we spend enough time focusing on something new, which is really what you all are looking for from future treatments and kind of thinking short of that cure, what might represent an ideal treatment. So that's going to take us to our final polling question of the day. So one last time, go to www.pollev.com/Fabry. And here we want to know, without considering the side effects of the drug, which of the following would be most important to you in a future treatment? And here you can select your top 2 choices. The options are A, to slow or stop the progression of the condition overall, but without improving symptoms. B, slowing the decline in kidney function, for example, or this might represent a delay in the need for dialysis or transplant. C, slowing the decline in heart function. D, preventing stroke. E, something that does improve your symptoms. F, something that prolongs your life. Or G, some other aspect of a future treatment that is most important to you without, again, considering the side effects of that drug. So as you're thinking about this question and picking up to your top 2 preferences for what you're looking for in a future treatment, think about what this would mean for your life if you did have a drug that did one of these things, how you might measure success in your own life, or how you might pose a question to your doctor in terms of trying to assess whether that drug would provide this to you. So we'll give you a few more moments here. So what we're seeing is quite a range of different top future treatment goals. Perhaps the ones that are the top 2 are preventing stroke and slowing or stopping progression of the disease overall. We see close behind that, slowing decline in heart function, improving your symptoms, and prolonging your life. And then below that, we're seeing slowing decline in kidney function as well as other things that aren't listed here. So we want to hear why you picked these. Are these the things that are least addressed by current treatments? Are these the things that your family history has been most prominent kind of in seeing? Or is this for you just something that personally would help you the most in your daily life? So we encourage you to call in. This will be my final pitch for the day on this important topic of future treatments. You can call in at 1-703-844-3231. Again, 1-703-844-3231. Or please feel free to just drop that comment into the comment box underneath. But I'm going to circle back here to my Zoom panel, to ask you all what you think, would be short of a cure for Fabry. What would you be looking for in a next future treatment? Linda, maybe you can start us off on this topic.
Yes, I answered that as slow the decline in heart function and prevent stroke, because that I'm having heart problems now. It's just personally.
Yeah.
But I am very interested in the gene experiments now going on. I'm looking for cure. Even at my age, I think it's not too late to look for maybe not having to take medicine again. Wouldn't that be wonderful?
Yeah.
So that's what I hope and pray for in my future.
Yeah, well, thank you, Linda. And you know, you said you are experiencing some heart problems now. You know, is it, you know, would it be okay if something kind of kept you where you currently are? Would you expect some kind of improvement? Kind of what would be your measure of success from a treatment for the heart condition?
Well, my heart doesn't seem to be declining that much. I think preventing stroke is something for all Fabry's patients. That would be a wonderful thing to see developed.
Sure. Well, thank you, Linda. Juby, same question. You know, as you were looking at that list of things, maybe something else that wasn't there. You know, what would represent a meaningful, you know, kind of future treatment outcome for you?
If it improves my quality of life, improves my functional capacity, something that I'm open to looking at, because, I look normal, but I'm not. And it's very hard for people to understand that.
Yeah.
But I, like Linda was saying, with the technology and things of what we have now, I'm also looking for a cure or a permanent solution, not a maintenance, lifelong, and me looking from healthcare finance yearly spend, that doesn't make sense anymore.
Sure. And on the first part of your answer, when you mentioned something, if it would improve quality of life, you know, is that improving certain symptoms? You know, how would you describe for you what that would look like?
Because of the number of chronic conditions, which adds to what you want to call chronic conditions that I have, it's a personalized medicine approach for me. I don't fit into any other boxes.
Yeah.
So I'm looking at personalized medicine that also has a genomic component. CRISPR or not CRISPR, something else that's going to come out down the pike would be what I'm looking at for my personal reasons, so that I can live longer. I have 2 young kids. I have a life to live, and I'm not planning to give up on that. So I'm going to proactively approach it.
Yeah.
I hope I can continue to do that.
Yeah. Well, thank you, Juby, so much. Cheryl, as we're kind of going around, we know this is, as it is for each person, a very personal question of what, you know, would be a top treatment goal that you would hope that a future treatment could address or provide.
I would love a cure. I'm going to get a little emotional here, but my daughter and my grandson have Fabry.
Yes.
My grandson has been on infusions since age 7. And thank gosh, there's no protein. My biological father died of kidney disease in his 40s. He's 24 and doesn't have any kidney damage. I want that to continue. I want a cure for the young people.
Yeah. Well, I think we hear that loud and clear, and I think we all agree with you there that is the ultimate goal. And Mary Frances, to close out our Zoom panel here, before we jump over to some phone callers, I'd love to get your take on this question of what would represent an important, you know, next treatment kind of outcome approach for you.
A treatment outcome for me, also, I agree with everybody. A cure would be awesome. My son's been on the enzyme replacement therapy for 16 years.
Yeah.
And he gets it at home, and he uses his arms, and I just wish he had more. And my granddaughter has Fabry's too, but she's not on any treatment. She's 20. But yeah, a cure would probably be the best. And more studies on stroke and the white matter in the brain, and more studies for women. I know the gene therapy studies will take men, but I'm not sure that the women have been included yet. And I think it's time, because we're all out here having the same problems and issues as the men are. So yes.
Yeah, we hear you loud and clear on that as well. So thank you for saying it. Well, I want to thank our Zoom panel so much for your contributions on this discussion of current and future treatments. We're now going to hop over to the phones here. I know we have Amy from Baton Rouge, who, her daughter was actually one of our earlier presenters in the day, but she'd like to share some perspectives on current and future treatments. So, Amy, I'd like to welcome you to the program. Are you with us?
Yes. Hello, how are you today?
I'm well, thank you.
I just wanted to thank you all for letting us share our experiences and opinions. I'm a physician as well as a wife and mother of a Fabry's patient, and I think the experience is so different from patient to patient.
Yes.
My husband is essentially asymptomatic after 15 or 17 years, I guess, of Fabrazyme, but my daughter remains very symptomatic.
Okay.
And so my ask would really be to expand treatment to kids. It'll help me get a little emotional. Watching her has been the worst thing in my life. It's very frustrating that it's not expanded to children. She initially made some progress with her Fabrazyme.
Okay.
But now she's developed antibodies and is symptomatic again. She's incredibly intelligent. She's a national merit finalist, but we cannot send her off to a good college next year because we can't let her go. She can't even make school 2 days a week right now, and so I would beg for more treatments for my child. I'm sorry.
No need to apologize at all, Amy. I just, this is really important for us to hear, and I'm sorry to hear that your daughter's, kind of the benefits she was getting from Fabrazyme have worn off due to the antibodies. If you had to, pick, one or a few areas that would most, make it so, your daughter's quality of life could be improved, could you tell us what those might be?
Sure. We're lucky enough to have Dr. Wallace as a physician, so I'm grateful for that. But she has debilitating fevers several days a week. So she'll be fine 1 minute, and then in 20 minutes she will have a fever of 103. And she becomes completely non-functional. She's this happy-go-lucky kid who says, hey, you want to help me make cookies? And then she has 103 fever and literally can't get off the sofa. So I think as an external person, and even as a physician, I hear everyone talking about this fatigue that they have. And you kind of, as a physician, you downplay that. And you're like, oh, fatigue, you're fine. You can get up and do it. But when you watch one of these patients do this, all of a sudden it's very impactful. To see them go from perfectly fine to just absolutely miserable and non-functional. My husband and I are both pediatricians, so she would complain and we would say, oh, suck it up. Your leg has to be falling off before we let you stay home from school. But after being tough on her for a long time, we realized, man, she's really hurting, and this is really serious, and fatigue doesn't really describe it or encompass what these patients have to go through. So fighting her debilitating fevers and really preserving her kidney function, which is now worsening despite us doing the only treatment that we have available, which is Fabrazyme.
Right.
If somebody told me today she could do gene therapy, I would sign her up knowing the risks.
Yes.
Or if somebody told me today that she could do Replical, we would start tomorrow.
Right.
It's just that she's limited by her age. And I know a lot of the studies are limited to males only. So expanding to both sexes and expanding to children studies and some of the emergency use authorizations would be very impactful to these patients.
And if you don't mind, Amy, just since you mentioned it, in terms of kidney function, what has her trajectory looked like? Is she at a stage where if it could be stabilized now, that would be a benefit, or maybe you can just help describe that a little bit.
Yeah, so her creatinine clearance has decreased by about 50% over the past year, but she still has what is technically normal range kidney function because of, it's kind of a difficult thing to, I mean, I'm sure you understand. Anyway, the clearance is decreasing, but she's still in the normal range. So if we could arrest it right now, we would save her probably from dialysis in the long term, which would be awesome. Right now, we're just trying to get through day to day and getting her to school and, you know, having her have somewhat of a normal life, being able to make friends that she hasn't been able to do in high school,
Right.
Being able to go to college, do all that stuff. But yes, eventually preserving her kidney function and making her not be on dialysis would be the goal.
Right, right. And just, you know, I know you mentioned a little bit about, you know, if she were eligible for a gene therapy trial, you would enroll her in a second. You know, this kind of ties back to a conversation we were having a little bit earlier today. But you know, is there anything that would be a deal breaker for, you know, either participating in a trial or even, you know, if something were approved, you know, trying a new drug, whether that was kind of on the risk side or, you know, the burden of undergoing a treatment?
Well, you know, I think right now, essentially failing Fabrazyme, there's not much that would be a deal breaker for us because it's really our only option.
Right. Yeah. Well, Amy, thank you.
Of course, whatever Dr. Wallace says would weigh heavily for us, but.
Of course. Well, Amy, I just want to thank you so much for you know, calling in, volunteering, being willing to share, and you know, letting me, you know, ask you some hard and personal questions. But I think it's just so valuable to get your perspective on what would be meaningful for your daughter. I'm sure there's many people who, you know, are in a similar place, and so, you know, you kind of giving voice to that is going to be really important to, you know, kind of move the ball forward collectively here. So at this stage, you know, we're at the end of the portion of our meeting where we're asking all of you to share your voices. I just want to, as the meeting moderator and the person who's, you know, you've been talking to, just want to personally thank you all so much for, you know, being so brave, helping really pull back the curtain on what is the current state of things for people living with Fabry. You know, I know I've been so pleased to hear that so many of you have been, you know, getting the benefits from the current treatments that you do have. At the same time, you know, it's really been hugely impactful on me to hear about what, you know, still is needed for so many of you. You know, and not just for you yourselves, but, you know, this family effect that so many of you, you know, are caring for your parents or have seen cared for your parents in the past, and now you're looking towards the future for your children. And so, you know, I just want you to know, as someone that's been working in this space for a long time, that your comments today matter. It's what is going to, you know, David talked about hope at the beginning of today's meeting. Your participating today is what is going to drive that hope and bring that hope for the whole community. And it just means so much that you were here and a part of today. So at this stage now, we're going to move to hear some summary remarks from my friend and colleague, Larry Bauer. It's an impossible task to try to reduce what we heard through so many rich stories and experiences into just a few minutes recap, but he really is the perfect person to do it. Larry, you know, spent 17 years at the National Institutes of Health as a you know, research nurse, and I know worked in lysosomal storage disease research. He then went to FDA and co-founded the Rare Diseases Program within the Center for Drug Evaluation and Research, where he worked as a research scientist for 10 years, and has been an integral part of helping plan and organize this meeting now. So without further ado, Larry, take it away.
Thank you so much, James. It's been an incredible day hearing everyone's stories. And I'm going to do my best to summarize. It's going to be a high-level summary. I apologize in advance if there's any important points that were made that I do not get to in my summary, but please know that those points will be in the voice of the patient report that will be put together at the end of the meeting. So today our meeting was opened by David Feldman from the National Kidney Foundation. This was followed with a presentation from Dr. Petrula Smoku from the FDA Center for Drug Evaluation and Research. Dr. Smoku shared that PFDD meetings are valuable to the FDA to learn from the experts, the people living with Fabry and their care partners, to try to help facilitate treatment of developments, to design clinical trials, and review new drugs for Fabry. There's a lot to learn, and they want to learn from patients and caregivers since only the patients know firsthand what the impact of Fabry has been on their lives. This was followed by a clinical overview presented by Dr. Anjay Rastogi, who's from the University of California at Los Angeles. He directs the UCL's Fabry program there. He told us that Fabry is a rare X-linked genetic lysosomal storage disorder. There tends to be progressive loss of function, that it affects the heart, the kidneys, the neurologic system, and all organs. In general, he said males are more severely affected, but as we heard during the meeting, this disease affects all genders. There's a classical form where there's less than 1% of enzyme activity in the body, and then a non-classical form where there's still some residual enzyme activity. This disease is often misdiagnosed as multiple sclerosis, growing pains, juvenile rheumatoid arthritis, and irritable bowel syndrome. And it needs a multi-system approach to treat various body systems, and it's treated with IV galsidase enzyme replacement or Fabrazyme, and also oral migalastat and adjunctive therapies. So then in the morning, we heard from a panel of people. The first person we heard from, these people were all talking about symptoms and life impacts. We heard from Kim, who's 53 and was diagnosed at birth and lost her father to Fabry when he was 52 years old. 7 people in her family have had Fabry. She's got fevers, pain, and burning in her hands and feet. She's developed atrial fibrillation and heart block and has had an acute ischemic stroke. Daily pain and fatigue present challenges to professional life, and she worries about how Fabry will progress as she ages. We heard from Rowena, who was diagnosed 16 years ago and experiences a lot of temperature sensitivity. The slightest changes in temperature upsets her body. She experiences arthritic-like pain and flu-like symptoms, and trying to regulate her body temperature can take hours. We heard from Paige, 17 years old, who was told she would just be a Fabry carrier, but she's had high fevers, exercise intolerance, and worries how Fabry will affect her life when she's in college. She's had kidney infections, strep, and flu, and was told, rather than Fabry, that she had psychiatric problems, and she eventually had to quit cheerleading from the impacts. And finally, in the morning, we heard from Caitlin, who's 37 years old, and her father also had Fabry and had 2 kidney transplants. She experiences pain in her extremities and GI symptoms, including stomach pain, diarrhea, and constipation. She has tinnitus and severe headaches. She has proteinuria, but thinks treatment has helped to regulate that. She experiences anxiety related to Fabry and wonders what her future holds. Her 8-year-old son also has Fabry and has foot pain, GI symptoms, and angiokeratomas. So overall, we heard some of the greatest impacts on people's lives with Fabry include heat and cold intolerance, pain, fatigue, GI issues, heart problems, and kidney disease. Anxiety and depression are very common and great concerns for the future, as is disease progression, the ability to live independently in the future, end-stage kidney disease, heart disease, and stroke. Then in the afternoon, we shifted gears talking about treatments and a little bit about research. We started with a presentation from Dr. Eric Wallace from the University of Alabama at Birmingham, who spoke about challenges in Fabry clinical trials. He said it's challenging to find a representative population, and there's challenges finding the right trial endpoints for studies. Also, when is it that you should start a new therapy? At what point in the illness? Early on, later in disease progression? And what is the current standard of care, and how do patients differ from one another so that, you're really understanding what the effect of a drug is on someone? And he said that Fabry is a multi-system disease. So, what do you measure and what outcomes correlate with long-term outcomes? Then we had a bit of a discussion on considerations for research participation. Overall, it seems like many people are willing to participate in trials. They realize this is the way to get better treatments for Fabry, and they would all like to have benefits to reduce symptoms and especially to benefit the heart and kidney effects. We heard from our second panel of people in the afternoon. Paul's 46, and he's had Fabry for years. Enzyme replacement therapy did not stop progressive kidney disease, and he had a kidney transplant. For a while, Fabrazyme was unavailable, and this led to GI issues like diarrhea. He also uses Galafold. He eventually had a stroke and is not sure how much treatment has helped all of his symptoms. And he wishes that there was a treatment that would cross the blood-brain barrier. We heard from Jennifer, who's 56 and has many family members with Fabry. She had to terminate a pregnancy when testing found out she was carrying a male child with Fabry disease. She started valsartan to protect her kidneys. She had a kidney biopsy that showed kidney involvement and then started Fabrazyme. Having the infusions at home is better than having to travel, but still has its drawbacks. And she fears in the future developing more severe kidney disease. We heard from Lisa, who needs a walker due to leg pain. She lost a brother to Fabry-related kidney disease. Lisa's done infusions for about 7 years, and they take a whole day. She said after so many years, her veins are scarred, but she's not really sure about wanting to get an IV port for future treatment. She wishes there were better options like a daily pill and wants more normalcy in her life. Then we heard from Chris, who's 51 and was diagnosed at age 16 when they found protein in his urine. He's needed 3 kidney transplants and periods of renal dialysis. He's also needed triple bypass surgery. And over 2 decades, he's added up that he's been in over 2,400 hours of treatments, and he regrets the time he's lost with family and friends. He hopes to transition someday to oral therapy. And because of the transplant, he has to take immunosuppressants like tacrolimus, Myfortic, Imurin, and cyclophosphamide, as well as steroids at times. Some of the side effects from his meds are arthritis, foot pain, blood sugar issues, GI issues, and fatigue. And he hopes better treatments would let his family and friends have to worry less about him. And finally, in the afternoon, we heard from Tabitha. She's 37, has 4 children, all of them diagnosed with Fabry. She's on Fabrazyme. She gets gut-wrenching cramps and diarrhea about an hour into her infusions. She gets, though, however, an increased energy boost after the infusions, which really helps with her typical fatigue. It's overwhelming to have several family members all on home IV infusions. It's just a lot of drugs, delivery of drugs, equipment, and she'd like to see a treatment that stops disease progression. So we've heard about the unmet medical need, including pain, burning in extremities, kidney issues, cardiac issues, and strokes in Fabry. Each of these symptoms has incredible quality of life impacts. Some of the treatments, they include enzyme replacement therapy as well as oral treatments. And the treatments from a lot of people have been very helpful, but they are inconvenient and they take a lot of time to administer. And we heard again and again, everyone hopes for a cure for this disease, especially when talking about the young people that are coming up in life that are just dealing with Fabry now. So in closing, I would like to turn the meeting back over to David in the studio. So thank you.
Thank you, Larry. That was a great summary. Our final speaker needs no introduction to this audience. It's a real pleasure to ask Jack Johnson, the Executive Director of the Fabry Support and Information Group, for some closing thoughts. Jack?
Thank you, James and David, for doing such a great job moderating today's discussion. And thank you to Larry for the comprehensive meeting summary. Of course, thank you to the National Kidney Foundation for your efforts making today's externally led patient-focused drug development meeting possible. It truly would not have been possible without your collaboration and hours of hard work to bring everything together. Thank you to the FDA for giving us permission to hold this meeting and to the FDA staff who tuned in today. Special thanks to Shannon Spanklin and Karen Jackler from the FDA who guided us through this process. Thank you to Dr. Petrola Sambuku from the FDA for her perspective on the importance of externally led patient-focused drug development meetings. A special thank you goes to the Division of Rare Diseases and Medical Genetics and Cardiology and Nephrology of the FDA. Their outstanding collaboration in making this possible has been phenomenal. I would also like to add that we realize there can be significant challenges when coordinating events such as this across 4 time zones and recognize the extraordinary level of commitment involved by today's participants to make it all work so well. Thank you to the National Kidney Foundation staff and leadership team for your partnership. A special thank you to Anthony Gucciardo and Stephanie Kojin, who handled phone and comment screening. Thank you to Drs. Rastogi and Wallace, who highlighted disease manifestations and challenges to trial design. Thank you to our supporters and our partner organizations. A huge thank you goes to the Fabry community attending and taking part in this very important opportunity to share your stories, comments, and concerns. There is incredible power in the presentations and experiences that have been communicated today. Other Fabry affected, caregivers, family members, medical professionals, researchers, pharmaceutical industry representatives, and regulatory agency authorities all will walk away having gained value from this meeting, and I thank you all for being here. We know they have heard your voices and will apply their considerable talents to improve the understanding of this disease and target continuing disease manifestations. A number of clinical trial opportunities have recently increased with the promise of additional phase trials and still more treatment approaches to come. With all the innovation in various stages of the approval process, there is incredible hope for additional treatment options with improved next generation potential. As these trials progress and protocols are developed with input from the FDA, your words from today will influence and help shape how future trials are conducted and the goals they hope to achieve. This impact will be facilitated through the voice of the patient report. This will be generated as a result of your vital participation today. The voice of the patient report will be a detailed report from this meeting and will be made available on the NKF and FSIG websites along with a recording and transcript from the full meeting. You can submit your comments that you may think of for after today's meeting for an additional 30 days. Send them through the comment form on this live stream website. Submitted comments will be included in the Voice of the Patient report. The video of today's proceedings will be available on this page as soon as the meeting concludes. The report, along with a list of supporters and partner organizations, will be made publicly available to anyone once it's published and posted on our websites. It is clear that Fabry is a rare, complex, heterogeneous, relentless condition with significant impact on daily quality of life as well as duration. While to date it is evident that the overall course of Fabry can be altered to varying degrees, reversing or permanently stopping the insidious disease progression in its tracks remains elusive. The greater Fabry community, without a doubt, is immensely grateful for the current treatment options that go beyond mere palliative care. However, there remains significant unmet medical need. Thank you. Back to you, David, in the studio.
Thank you very much, Jack. Well, this has been a wonderful meeting. Thank you, everyone, for staying with us today and for painting such vivid pictures of what it's like to live with Fabry disease. You have been heard, and you can be certain that the representatives from the FDA and pharma were listening carefully to the input you gave today. And now I want to thank the incredible crew here at Dudley Digital Works for their expert and meticulous planning and execution of today's broadcast. It's been a total pleasure to work with all of you again. So please watch for the recording of today's meeting and next year our Voice of the Patient report. Stay safe, stay well, and have a pleasant rest of your day.